Hello everyone, a very good evening to all of you. Am I visible, audible? First you have to confirm if visibility, audibility is good. My slides are visible to you. I'm clearly visible, audible, so I can go ahead. You can write that in the comments. I can see your comments. You can tell me whether I'm clearly visible or audible. Kindly let me know. Is it? Gopal, Ankara, Medico, Mukul, Shifana. Kindly write down something. Okay. Let me see. I guess there is a delay or little bit lag. Okay, thank you Yogesh, Shifana, thank you so much. So I guess I'm clearly visible, audible to all of you. So let's start ahead. I welcome you all for today's session. A very good evening to all of you. And today in the next few hours, we are going to cover many important topics of microbiology. I will make microbiology a fun for you, believe me. So without wasting any further time, I guess you have attended my session 1 of microbiology. Let me come on this session. Just a second. Okay, let me see. Okay, yeah. So the first topic I'm going to cover is hypersensitivity, right? Now you get many questions on hypersensitivity, the pathogenesis and the examples, and students really get confused. So the next 5 minutes I will make all type of hypersensitivity reactions of fun for you, all the pathogenesis as well as all the examples. So you know what is hypersensitivity reaction? What is hypersensitivity reaction? What it is? So we all have immune system. The humans have immune system inside us. Is it a good thing or bad thing? Whenever any foreign material, foreign particle, microorganism enters in human body, the human reacts to that with the help of immune system. So I'm asking to you, immune system is good or bad? Is it protective? Yes or no? What is the answer? Yes, of course, the immune system is good for all of us. But sometimes the immune system becomes excessive, and that excessive, exaggerated state of the immune system is known as hypersensitivity. So apart from killing and causing damage to the foreign particles, it causes harm to the host cell also. That is known as hypersensitivity. So first, you must understand the definition of hypersensitivity. The definition of hypersensitivity is that it is the exaggerated state of the immune response. Now, Coombe and Gell, these are the two scientists who had classified hypersensitivity among 4 types. It is known as type 1, 2, 3, 4. We are going to discuss all of them, the pathogenesis and examples of each of them one by one. Before that, let me tell you one more classification of hypersensitivity. It's the immediate type and delayed type, the 2 types. Immediate types acts immediately within minutes or within hours, and it is mediated by B cells, that is antibodies are produced. And delayed type is slower in onset. It takes at least 48 hours, 2 days or to 72 hours, and it is T cell mediated, that is cell mediated. T cell mediated, that is cellular immunity comes in role. So here humoral immunity, here cellular immunity. So I told you, there are 4 types of hypersensitivity reactions. Among the 4 types, the first 3 types are immediate type and the last one is delayed type. I mean to say the first three are mediated by B, that is B cells, that is humoral immunity, and the last one is mediated by T cell, that is cell mediated immunity. So let me tell you the type 1 hypersensitivity, commonly known as allergy. Now many people are allergic. Now the person can have allergy to different allergens. The allergen can be dust, can be pollen grain, can be anything. So let me tell you the mechanism first of allergy, So let me tell you, this is the antigen entering in human body. This is the antigen entering in human body. This antigen is the allergen. It can be dust or pollen grain. The first cell it will interact is the antigen presenting cell. It's the antigen presenting cell, APC, antigen presenting cell. The antigen presenting cell will engulf the antigen inside it, degrade the antigen and process it into multiple pieces and present it on the surface with the help of MHC, major histocompatibility complex. After that, it will present this antigen to the next cell. The next cell in the role is helper Th2. It's Th2, mind it. It's helper Th2. You will get many image-based questions also based on the pathogenesis, apart from many conceptual questions. So the antigen is going to the first cell, that is antigen presenting cell. After that, it is presenting to the next cell, helper Th2. The helper Th2 is secreting various types of interleukins from it. Interleukin 3, 4, 5. So among them, the interleukin 4 is going to the next cell. The next cell in the role is B lymphocyte. It's B lymphocyte. On getting the signal, on stimulation, the B lymphocyte get converted to plasma cell. The next cell in the role is the plasma cell, right? So it's the plasma cell, it's going to the plasma cell, and the plasma cell will get stimulated, it will start forming antibodies. Now there are 5 types of antibodies now: IgG, IgA, IgM, IgD, IgE. Among them, IgE is formed by the plasma cells. It's IgE which is formed. This IgE will move to the next cell. What is the next cell in the role? The next cell in the role is the mast cell. It is a mast cell. On the surface of the mast cell, this IgE antibody will go and bind like this. This step is known as sensitization. What does it known as? Sensitization. Now, the antigen, if the same, now this process is over. If the same antigen enters human body second time onwards, any consecutive time, so it will go directly to the antibody, because now this antigen is entering the second time now. So body have a memory, the immune memory. Immune system have a memory. The immune system will recognize the antigen, you are the one which have entered human body previously also. So we will not repeat the entire process again. No. You directly go to your antibody. So this time this antigen will directly go to the antibody which is already formed in the previous entry. So this will go, it will bind with the antibody. So antibody antigen complexes are formed and antibody will give signal to the mast cell. On receiving the mast cell signal by the mast cell will burst, the mast cell will rupture, and this is known as degranulation of mast cell. What it is known as? It is known as degranulation of mast cell, and the granules will come out. All the granules will come out here. The granules are coming out, and these granules contain multiple cytokines, multiple chemicals. The most important are histamine, it can be serotonin, the histamine, serotonin, it can be various other things also like leukotrienes, like prostaglandins, like platelet activating factor, and these all causes the various things which happens in allergy. Like they all causes bronchoconstriction, they leads to vasodilatation, they increase the vascular permeability, they lead to edema. So all the things which happens in allergy are caused by these chemicals. So this is the mechanism of type 1 hypersensitivity. Give me a thumbs up if you got it. Give me a thumbs up. Yes, everyone, you got it? You got the mechanism? So this is the mechanism of type 1 hypersensitivity, that is known as allergy. Now, if type 1 hypersensitivity involves a particular system, just suppose if I eat anything, I have diarrhea. So I am having the allergy involving the GIT system. If I apply some ointment or something cosmetic on my skin, I can have dermatitis. So I am having the allergy limited to the dermal system, right? So the limited system involvement is known as atopy. It is localized, but sometimes allergy can be fatal. It is systemic. It involves the complete body and it is known as anaphylaxis. Anaphylaxis and atopy are the two names given to allergy. So allergy can be localized, can be systemic. If it is localized involving a particular system, it is known as atopy. And if it is systemic involving the entire body, it is known as anaphylaxis. Very good. So the same thing is shown in front of you, the same mechanism. You can read the flow chart. I will provide you the notes. The notes will be provided on the Telegram group of Cerebellum. You can join the group and download the notes from there. So you can read the same flow chart. So first time the antigen is coming. The antigen will go to APC, antigen presenting cell. Antigen presenting cell will go to Th2 type of cells, helper Th2 cells. The helper Th2 cells secrete interleukin 3, 4, 5. Interleukin 4 activate B cell. B cell convert into plasma cell. Plasma cell will form IgE antibody. IgE antibody will go to the mast cell and bind on the surface of the mast cell. Now, if the same antigen entering second time, it will directly go to the antibody which is bind on the mast cell, right? And causes the lysis. Causes the rupture of the mast cell leading to degranulation. In degranulation, all these chemicals come out. It can be histamine, serotonin, VIP is vasoactive intestinal peptide, leukotrienes, prostaglandins, platelet activating factor, and they all lead to allergy. This is the mechanism of allergy. You got it? This is the mechanism of allergy. Now coming on the examples of type 1. How many examples you know? So you will see, ma'am, all the examples of allergy will be there. So it can be eczema, hay fever, asthma is a type of allergy, you know. So it can be asthma, urticaria, anaphylactic shock, acute dermatitis. We all can identify these are the different names of the allergy, right? We all, no need to learn. Of course, everyone knows these are allergies, the different names. What we forget in the exam now is the named reactions. You can You can get confused in the name reaction like Theobald-Smith phenomenon. PK is Putzner-Kutzner. PK reaction, Putzner-Kutzner reaction. Cassoni test, it is a skin test, right? And Schultz-Dale phenomenon. These are the named reaction. These are also examples of type 1. So let me give you a mnemonic for the named reaction. So can I say the examples of type 1 are in front of you? All type of allergies. It can be asthma, hay fever, urticaria, the different types of allergy you may be knowing, along with 4 named reaction. The mnemonic is proximal convoluted tubules, PCTS, right? PCTS in the kidney. It's a mnemonic. So here P stands for Putzner-Kutzner reaction, T stands for Cassoni test, T for Theobald-Smith phenomenon, and S for Schultz-Dale phenomenon. So here Schultz-Dale phenomenon I will explain you. What is Schultz-Dale phenomenon? What you have to do now, in Schultz-Dale phenomenon, take a guinea pig. So let me take a guinea pig. So this is a experimental animal. This is guinea pig. In the guinea pig, what I am doing? I am injecting the antigen for the first time. So what all will happen inside it, you may be knowing that. So antigen is going, the antigen first going, it is going to APC, you know that. APC stimulate the TH2, TH2 will stimulate B cell stimulate the plasma cell will form IgE antibodies which will go on the mast cell and remain there forever, right? Now I am not giving the antigen second time, no, I am killing the guinea pig. Let's kill it, let's sacrifice it, right? Don't say kill, say sacrifice. Let's sacrifice the guinea pig, kill the guinea pig and take the organs out. Now take a tub, you can take a tub here and fill it with the ringer lactate solution and take the organs like uterus, intestine, the GIT, all the organs in ringer lactate solution. Now give the second dose of the antigen. The second dose of the antigen here in vivo or in vitro. It is known as in vitro. It is outside the animal body. So basically the first dose I am giving in vivo and the second dose I am giving in vitro. If I am giving the second dose in vitro, what will happen? These all organs are already sensitized. So you will see all these organs are contracting in front of you. You can see the contraction in front of you. So all these organs are contracting in front of you like this. It is known as type 1 hypersensitivity in vitro. And that is known as Schultz-Dale phenomenon because it was performed by a scientist Schultz-Dale. Give me a thumbs up if you got it. Do you have any confusion in that? Do you have any confusion in that? Thank you so much for your comments, for your feedback. Thank you so much. Can you tell me, do you have any confusion? Otherwise, I will proceed ahead. So that is the Schultz-Dale phenomenon. So can I say Schultz-Dale phenomenon is anaphylaxis in vitro? Basically, we are giving the second dose of the antigen in vitro. So we already take a guinea pig in which the first dose is already given. So that is sensitized guinea pig. We are killing it and taking the organs out. And after taking the organs out, we are putting the antigen, the second dose onwards in vitro. And we can see organs are contracting in front of you. This is known as Schultz-Dale phenomenon, which is an example of type 1. So we finished type 1, the pathogenesis and the examples. Let's come on type 2. Type 2 is antibody-mediated cytotoxic reaction. Let me tell you the mechanism. I guess it's very easy. I will draw it again for you. So here, this is the antigen. You will say, ma'am, what is the difference? In the last one also we were having an antigen. The antigen is very specific here. It is not a free antigen. The antigen is present on the surface of a target cell. This is a target cell. So the antigen is present on the surface of target cell. The target cell is a host cell. This is the antigen, right? This antigen directly stimulates B lymphocyte. It is not going to APC like type 1. It is directly stimulating to B lymphocyte. Directly. Antigen presenting on the target cell, directly stimulating the B lymphocyte. I'm coming on your doubt. Wait a while. I'm coming. I will solve all your doubts. Let me finish it. So the antigen present on the target cell directly stimulating to B lymphocyte. B lymphocyte convert into plasma cell and plasma cells start forming antibodies. Which antibodies will be formed this time? Is it IgE? No. This time IgG and IgM are formed. So here, in contrast to type 1, direct activation of type B or B lymphocyte, there is no need of antigen presenting cells and helper Th2 cells. No need. Directly B lymphocytes are activated, and in contrast to type 1, here antibodies are IgG and IgM. Right? Now what does these antibody will do? They will go to the antigen and form a bond with the antigen. So let me draw the antigen again. This is the antigen presenting on target cell. These are the antigens. So these antibodies which are formed against the antigen, they will go and bind there on the surface here. So antigen antibody complexes are formed like this. These antigen antibody complexes stimulate the complement system present in blood. So here complement will come in role, you know. So there are C1 to C9, we have these complement now. Among that complement C3b will be activated. That acts as the opsonin and it will also come and bind here. So triplet is formed, antigen, antibody, complement. Antigen, antibody, complement. A triplet is formed and this C3b will act as the opsonin. That is, what do you mean by opsonin by the way? It attracts the phagocyte. It attracts the phagocytes for phagocytosis. So basically in the end, a phagocyte is coming and engulfing all of them, engulfing the triplet. So antigen is engulfed, antibody is engulfed and the complement is engulfed. Usse problem nahi hai. The problem is that the target cell is also engulfed. Come on, target cell was a host cell. So there is injury to the host cell and that is the mechanism of type 2. In type 1, if you remember, the end result was allergy. That is causing harm to host cell. And here the end result is phagocytosis. That is causing the harm to host cell. You got my point? Say yes. You got it? Do you have any confusion in that? Shall I proceed ahead? Shall I proceed ahead? So that is type 2. In type 2, the antigen is coming. Antigen directly going to B lymphocyte. The B lymphocyte convert into plasma cell. The plasma cell will form antibodies, but it's not IgE. It's IgG or IgM. These antibodies will go to antigen, form antigen-antibody complexes. These complexes will activate the complement, especially C3b, and that will act as the opsonin and that results in phagocytosis, the same mechanism shown in front of you. Can you see a target cell? Can you see the antigens presenting on the surface of the target cell? Can you see it is stimulating B lymphocyte? It is not shown here. The B lymphocyte gets stimulated. It is forming antibodies. So these are the antibodies. It is converted into plasma cell. These are the antibodies which are IgG or IgM. Right. Now it is stimulating the complement, especially C3b. So triplet is formed. Antigen, antibody, complement. And this complement is attracting the phagocyte. A phagocyte is coming and engulfing all of them. Can you see the phagocyte is engulfing all of them? Yes. So this is the mechanism which I have drawn for you. You got my point? Coming on the examples. Examples here for type 2. I'm having a mnemonic for you. My mnemonic is my blood group is Rh positive. This is the mnemonic. By mnemonic you can solve many MCQs, believe me. Microbiology is all about mnemonics and concepts. Right? So here M stands for myasthenia gravis. B stands for blood transfusion reactions including ABO blood transfusion reactions as well as Rh blood transfusion reaction, that is erythroblastosis fetalis will also come here. Right? G stands for two things, good pasture reaction and Graves disease. Both of them are examples of type 2. I is ITP, immune thrombocytopenic purpura. R stands for rheumatic fever, H stands for hyperacute graft rejection and P stands for pemphigus vulgaris. So please learn the full form, and that is all about type 2. We have learned type 1, we have learned type 2, we have seen the mechanism as well as examples. Now coming on type 5, you say ma'am why you taught us type 1, you taught us type 2. Now after type 2, why you are coming on type 5 directly? Where is type 3 and 4? I will come on them. But type 5 is a modification of type 2. That's why I have to teach you type 5 immediately after type 2. So just now I taught you type 2. So I am teaching you now type 5. You got my point? The entire mechanism is same. Here also we have a antigen that is present on the surface of target cell. This is a target cell, right? Here also in type 5. Where is the difference? I will tell you. It will also stimulate the B lymphocyte. B lymphocyte convert into plasma cell. The plasma cell will form antibodies, IgG or IgM antibodies. These antibodies will come and bind here. The antibodies will bind here like this. Now till now it's same. Till now type 5 is same to type 2. Now it will make a difference. Right? What was happening in type 2 after this step? The complement system was coming in role and opsonin was coming in role and phagocytosis was happening. That is destruction of the target cell was happening. Destruction, right? Phagocytosis was happening. Here it will not happen. Here when antibody will come now, it will bind with the antigen. These antibodies are stimulatory antibodies, not destructive. These are stimulatory antibodies that will not stimulate the complement. Here complement C3b will not come role, but this antigen will get stimulated. This antigen will get stimulated and target cell will do overfunction. Whatever the function of this target cell now, it will do overfunction because of overstimulation of the antigen. That is known as stimulatory type. That is known as stimulatory type, right? So, right. So, type 5 is not given in the book. No, it's important. Nowadays, it's very important. Vision, it's very important, type 5. So, you will get, high probability, you will get examples on type 5. The questions on type 5 and examples of it. I am coming on the examples also. I will give you valid examples also. So, can I say type 5 is a modification of type 2? The only difference, instead of destructive, here the antibodies are stimulatory in nature. So, instead of causing the destruction of the target cell by phagocytosis, it is not causing here. It is causing the stimulation of the target cell. So, let's give an example. Let's take an example, right? You know, in human body, we have hypothalamus, pituitary and thyroid. There is an axis. So, in the brain, this is hypothalamus, right? And just below the hypothalamus, this is pituitary, okay? And this is the thyroid. This is the thyroid. So, this is the axis. Now, what do you mean by this axis? From the hypothalamus, TRH is released, right? Thyroid releasing hormone. It will go to pituitary. On stimulation, the pituitary will release TSH. This TSH will go to thyroid. You know that now. On the surface of thyroid, we have receptors for TSH. We have receptors for TSH. These are the receptors for TSH. So, TSH is the antigen binding with its receptor. When this combination takes place, when TSH comes and binds with its receptor, it secretes T3 and T4. Say yes, it secretes T3 and T4, the thyroid hormones. It happens normally. But in some persons, there is a disease known as Graves' disease. In Graves' disease, body is forming antibodies against the TSH receptor. So here antibodies are formed against the TSH receptor. The antibodies are coming and binding with the TSH receptor, but it is not causing the phagocytosis of thyroid. No, no, no. It is not destructing it. It is overstimulating it. So more and more and more T3, T4 will be released and person will have hyperthyroidism. That is the mechanism takes place in Graves' disease. Right. So basically Graves' disease is an example of type 5. So what all examples I taught you for type 2? This is the examples of type 2 I told you, no? Among them, myasthenia gravis and Graves' disease. These two are basically examples of type 5. So if type 5 is given in the options, go with type 5 for these two examples. If type 5 is not given now, you go with type 2 only, right? So type 5 is better for these two. Better option as compared to type 2. You got it? You got it? Can we go ahead? Can we go ahead? So Graves' disease is given in front of you and you can understand the mechanism of myasthenia gravis and Graves' disease. In the same way, in the myasthenia gravis, the antibodies are formed against the muscarinic receptors present on the muscle, right? So for acetylcholine receptors, muscarinic receptors, the same mechanism. So coming on type 3, we are done with type 1, we are done with type 2, we are done with type 5 also. Let's come on type 3. So type 3 is same as that of type 2. A little bit difference is there. Let me draw. You will understand. Let me draw. So here also we have antigen. So in type 1, the antigen was a allergen, a pollen grain, a dust particle. I will say allergen. In type 2, the antigen is present on the surface of a cell, the target cell. But in type 3, the antigen is soluble antigen. So it's the antigen which makes the difference, right? So the soluble antigen is coming here. The soluble antigen is coming here, right? So in the body, the soluble antigen is going. Now the mechanism, see, it is again stimulating the B lymphocyte like type 2. The B lymphocyte will convert into plasma cell like type 2. The plasma cell will form antibodies. Which antibodies? Again IgG and IgM like type 2. Now this antibodies will go and bind with the antigen. Antigen antibody complexes are formed. So this is antigen and this is antibody complexes are formed. Now what is the difference? Till now it's same now. Till now it's same as that of type 2. This antigen antibody complexes are not free in the blood. They will go to some tissue and bind on the tissue. This is the difference. They are going to the tissue and binding on the tissue. Antigen antibody complexes are going and binding on the tissue. On binding on the tissue, it will stimulate the complement. Here also complement is coming in the role. The complement system is coming in the role C1 to C9. But if you remember in type 2, it was C3b, which was the major complement. Here I will say C5 to C9 will come in the role. C5 to C9. What is C5 to C9? Have you read complement? If not read, I will teach you that also, don't worry. So C3b is optional, right? But C5 to C9 are membrane attacking complex. So basically they will stimulate the neutrophils and inflammation in the tissue. So there is inflammation is the end result of this. So inflammation will happen to this tissue because of C5 to C9 stimulation of the complement. So that is the end result. You got my point? What was the end result of type 1? It's allergy. What was the end result of type 2? It's phagocytosis. What is the end result of type 5, which is a modification of type 2? It's overstimulation of the cell, right? And what is the end result of type 3? You will see, ma'am, inflammation and tissue destruction, right? So this is the mechanism. Say yes. You got it? You got it? Agastya, I will teach you entire complement system. I will teach you the use also. Don't worry. There are many uses also. Here I am telling you the harmful effects, but complement is really useful, right? So I will tell you that also. It is a part of immune system. Anyways, the mechanism is given in front of you. Type 3. Here the antigen is soluble antigen. It is stimulating B lymphocyte. The B lymphocyte convert into plasma cells. The plasma cell will form antibodies. This time also it's IgG and IgM. The antibodies will form the immune complexes with the antigen and get deposited on the tissue. That makes the difference. Abhi tak to sab same tha. Yahan pe difference aaya. It will deposit on the tissue, right? And it will activate the complement, especially C1 to C5. That is membrane attacking complex, and that will cause inflammation and tissue destruction. That's it. So same is shown to you in this diagram also. Now coming on the examples. What are the examples of type 3? The examples of type 3 is sharp. S-H-A-R-P. Sharp. What is the full form of sharp? There is triple S. S means triple S. One is serum sickness, one is Schick test, one is SLE. All of them are examples of type 3 hypersensitivity, right? The next is H. H is HS purpura. Have you read this disease in pathology? Have you read SLE in pathology? Right? Schick test I will teach you in diphtheria. I will teach you all these gradually when I will cover entire microbiology. Don't worry. So HS purpura is an example of type 3 hypersensitivity. A for arthrous reaction. R for reactive arthritis. If you remember the examples of type 2, what was the mnemonic? My blood group is RH positive. What is the R there in type 2? It was rheumatoid arthritis, and this one is reactive arthritis. Don't get confused. वो rheumatoid था, ये reactive है. Exam में question ध्यान से पढ़ना है. Be attentive. Rheumatoid arthritis, type 2 hypersensitivity. Reactive arthritis, type 3 hypersensitivity. There is a minute difference, but that will make a sense. That will change your ranks by 1,000. You got my point? And P stands for two important diseases. Number one is PAN. What is PAN? Polyarthritis nodosa. What is it? It is a type of medium vessel vasculitis. And the second is PSGN, post-streptococcal glomerulonephritis, right? So that is the examples of type 3. I will revise all the 4 examples in the end. Let me finish the last one, type 4. Now till now in type 1, type 2 and type 3, B lymphocytes were coming in role. I taught you 3 mechanisms till now, right? In type 1, I told you type 2 and in type 3. In all of them, I told you there is an antigen which is coming in human body. The antigen is different. Here the antigen is the allergen. Here it is present on the surface of a target cell. Here it is soluble. But here it will ultimately stimulate B lymphocyte which form plasma cell, and IgE antibodies are formed. Here also IgG, IgM, and here also IgG, IgM. Basically, I am trying to say in all 3 till now, I told you that B lymphocytes get activated and antibodies are formed, some or other. So basically type 1, 2, 3, these 3 are humoral immunity mediated. But type 4, there will be no role of B lymphocyte. In type 4, now I am going to teach you type 4, the delayed one. Here I will tell you the role of T lymphocyte, not B. Here antibodies are not formed. कोई भी antibody नहीं बनेगी. Neither IgE nor IgG, not IgM, nothing will form. Here T lymphocytes will come in role. So the first 3, the B lymphocytes are coming in role and antibodies are formed. So these are the examples of humoral immunity. Humoral immunity is making a role here. But the last one, cell-mediated immunity, will make a role. Right? These are very complicated topics. But if you understand now, these are like fun. You got my point? So coming on delayed type, type 4. The only hypersensitivity which is cell-mediated, T-cell mediated. And it is the delayed type. As the name indicated, is delayed. The first 3 were immediate and this one is delayed. So what will happen here? Again we will draw. Without drawing I cannot explain you. So here the antigen is coming. What is the antigen here? What is the peculiarity of this antigen? In type 1, the antigen is allergen. In type 2, it is present on the surface of a target cell. In type 3, it's soluble. But here the antigen is non-degradable. What it is? It is non-degradable. So as soon as this antigen is coming in human body, it is stimulating antigen presenting cell. It is going inside the antigen presenting cell. Antigen presenting cell is engulfing this antigen, and mind my words, it is trying to degrade but unable to do so. What I have said? The antigen presenting cell is trying to degrade the antigen but unable to do so. Unable to do so. Why? Because it is non-degradable now. So antigen presenting cell have a trouble now. What to do? इसका करना क्या है? Body में आ तो गया antigen, पर degrade तो कर नहीं पा रहा है. क्या करें? So antigen presenting cell ना, it will take this antigen to helper Th1. It's not helper Th2. Mind my words. These all are your MCQs. Helper Th2 takes role in type 1 hypersensitivity, if you remember. यहाँ पे type 4 में helper Th1 आएंगे. So antigen presenting, oh my god, it's gone. I have to draw it again. Okay, so here is the antigen coming, and this antigen is non-degradable, and this is engulfed by antigen presenting cell. Antigen presenting cell is unable to degrade it. That's why taking this antigen to helper Th1 lymphocytes. Helper Th1 lymphocytes secrete 3 cytokines from it. Please learn the names. Please, I am requesting you. It will secrete 3 cytokines. What is the name of those 3 cytokines? What it will secrete? It will secrete interferon gamma. What it will secrete? Interferon. I will tell you the role. Interferon gamma, number 1. Number 2, it will secrete interleukins. Interleukin 1, 2, 12, especially interleukins. And number 3, it will secrete TNF alpha, tumor necrotic factor alpha. Learn these 3 names at the tip of your tongue. Please, you have to learn. तो ये 3 चीजें निकालेगा. 3 चीजें 3 सेल को अट्रैक्ट करेंगी. They will attract one cell from the blood vessel. This is the blood vessel. From the blood vessel, they will attract one type of cell. So total 3 type of cells will come here. What are the 3 type of cells that will come here? Let me tell you. The interferon gamma will take the monocyte out. Monocyte out of the blood. Monocyte once out of the blood, they are known as macrophages. So basically they are accumulating macrophages at this site. Macrophages. And not only accumulating macrophages, they are converting macrophages into modified macrophages. They will modify them by doing their cytoplasm more vacuolar, increasing the size, right? So modified macrophages are known as epithelioid cell. So basically interferon gamma is responsible for epithelioid cell. Say yes, it is responsible for macrophage and epithelioid cell. Multiple epithelioid cell will fuse with each other. Each epithelioid cell have 1 nucleus. Multiple will fuse each other and they will form giant cell. So monocyte convert हो गया macrophage में, macrophage convert हो गया epithelioid में, और epithelioid multiple fuse होके बना रहे हैं giant cell. और ये सब काम झाम कर कौन रहा है? कौन कर रहा है? ये सब कर रहा है interferon gamma. So interferon gamma का role is up to epithelioid cell and giant cell accumulation at this site, जहाँ पे where type 4 hypersensitivity is taking place. Right? Now what is the role of this thing? Interleukins. Interleukins will take the T lymphocytes out. T lymphocytes out here and accumulating T lymphocytes at this site. And what is the role of this TNF alpha? TNF alpha will take the fibroblast out. The fibroblast out and accumulation of fibroblast here, the spindle shape. So basically we are left with 4 type of cells. Number 1, epithelioid cell and giant cell as a result of interferon gamma. Number 2, T lymphocyte as a result of interleukin, and number 3, fibroblast as a result of TNF alpha. You got my point? Now these 4 cells will arrange and form a granuloma. Granuloma is the end result of type 4. How they will arrange? They will be at the center. These one I will draw. They are at the center. These form the middle zone and these are the outermost. Right? Let me draw it. Let me take a next page and let me draw a granuloma. At the center we are having epithelioid cells. These all are epithelioid cells. I am drawing few. Okay, at the center, and few giant cells also. Due to the fusion of epithelioid cells, these are the giant cells. Right? These are surrounded by T lymphocytes. The middle zone. This is T lymphocyte. These are the T lymphocytes. Right? And outermost is the fibroblast. Say yes. It is a granuloma. Come on. This is the diagram of a granuloma. So basically type 4 hypersensitivity results in the formation of granuloma. Can you tell me the 3 cells of granuloma please? The central one. These are epithelioid cells and giant cells, and these are due to interferon gamma. The middle one, these are T lymphocytes. These are due to interleukin 1, 2 and 12, and the outermost are the fibroblast. These are as result of TNF alpha. Say yes. So this is giant cell is formed, Mitra, because of the fusion of multiple epithelioid cells, right? Multiple epithelioid cells, some of them fuse with each other. So each epithelioid cell have one nucleus. When they fuse with each other, they will have multiple nucleus inside them, and that is known as giant cell, right? So that is the granuloma. You got my point? So this is the mechanism. Tell me the mechanism of type 4. Antigen is coming, which is non-degradable. It will go to antigen presenting cell. Antigen presenting cell is unable to degrade it. That's why take it to helper Th1. Helper Th1 will secrete 3 cytokines. What are the 3 cytokines? Interferon gamma, interleukins, and TNF alpha. And you know the roles of each of them. These all cells will accumulate and they result in formation of granuloma. The granuloma is in front of you. Can you see these cells? These all are epithelioid cells at the center, and this is a giant cell shown to you, right? And the middle zone, can you see this one? The middle zone, these all are T lymphocytes, okay? These all are T lymphocytes, and the outermost are the fibroblasts. You can understand, I guess. Give me a thumbs up if you got it. Say yes. Now coming on the examples of type 4. Coming on the examples. John gave tulip popcorn to Hershey. Hershey is a girl, and John has given tulip and popcorn to Hershey. So John stands for John motor reaction. It's a very important MCQ. Repeat MCQ. Tulip. TL. TL. Tulip. So tuberculin and lepramin. Tuberculin test, lepramin test. Say yes. Popcorn. PC. Popcorn. Pernicious anemia, contact dermatitis. PC. Hershey. Hashimoto thyroiditis. So say it. What we have learned. We have learned this. Instead of showing you this page, I guess you can understand this page. See? The 4 type of hypersensitivity with their mnemonics. Instead of showing you this page, let me write. Will you help me in writing the examples of 1, 2, 3 and 4? Will you tell me the mnemonics I told you right now? What is the examples of type 1? It's all types of allergy plus PCTS. So can you write it down? Gopal, Archie, Sheetal, Tanvi, Lokendra, please. All the students I'm requesting. Say yes. PCTS. What is the full form of PCTS? Proximal convoluted tubules in the kidney. Say the real full form. P stands for Putzner reaction. C stands for Cassoni test. T stands for Theobald-Smith phenomenon, and S stands for Schultz-Dale phenomenon. You know what's Schultz-Dale phenomenon? I told you it's anaphylaxis in vitro, in which we sacrifice the guinea pig, and we will do the second step outside the body. That is anaphylaxis in vitro. What are the examples of type 2? What are the examples of type 2? Mitra, Abu, Lokendra, Tanvi. What are the examples of type 2? So my blood group is RH positive. Say yes. Right. You know the full form. Shall I say it? M stands for myasthenia gravis. B stands for blood transfusion reaction, including erythroblastosis fetalis, RH and ABO both. Right. G stands for 2 things. Graves' disease and good pasture. I stands for ITP. Immune thrombocytopenic purpura. Very good. Very good. Div Singh. Very good. R stands for rheumatoid arthritis. Not reactive. Mind it. H stands for hyperacute graft rejection. And P stands for pemphigus vulgaris. I guess you know it. Type 3, the mnemonic is SHARP. S-H-A-R-P. You know the full form? S is triple S. S is triple S. It's Sheik reaction, Sheik test. It's SLE and it's serum sickness. You got it? Yeah. And P stands for 2 things here. That is PSGN, post-streptococcal glomerulonephritis, and PAN. You know others? Shall I repeat or you know it? So coming on type 4, John gave tulip popcorn to Hershey. I'm not saying the full form because it is wasting the time, but I guess you have done the mnemonic and you can. Knowing only mnemonic is very confusing. You should know the full form. Let's try. देखते हैं कितनों को समझ में आया और कितनों को याद हुआ. So we have learned the pathogenesis of the 4 types. Type 1, 2, 3, 4. In type 1, 2, 3, it's B cell mediated. It's B cell, but the type 4 is T cell mediated. I told you. Here IgE antibodies are formed. Here IgG and IgM are formed. Here also IgG-M are formed. And here end result is granuloma. You may be knowing the end result of all of them. Here the end result is allergy. Here the end result is phagocytosis. Here the end result is tissue destruction and inflammation. And here the end result is granuloma formation. Say yes, you know the complete flowcharts, I guess. And you know the mnemonics of the examples of all four. That's more than sufficient for knowing the topic. More than sufficient, I guess. Say yes. You want type 4 examples, one more. Pal, I will tell you. So John gave tulip popcorn to Hershey. So John Mote reaction, J for John Mote, T or L very easy. Tuberculin, lipramin. One is tuberculin, one is lipramin, right? P is pernicious anemia. C is contact dermatitis and H is Hershey. Say yes, say yes. The details, Mitra, I will give you, but I will not explain you the complete mechanism of John Mote reaction here. But it is an example of type 4. In all of them, the granulomas are formed. You know the mechanism. So let's solve some questions. Let me see who is first and correct. Both. You have to be first and you have to be correct. Let me see who is the first. Read the question. Tell me the answer. B cell mediated hypersensitivity reaction is. Which among the following is a B cell mediated? Is it arthros reaction, contact dermatitis, delayed type reaction or tuberculin? I'm asking which is B cell mediated. Which is B cell? So I told you type 1, type 2 and type 3. All of them are B cell mediated. But the type 4 is T cell mediated. I told you it's a repeat MCQ from your previous year question papers of NEET PG. You tell me the answer. Yes, everyone is correct. Everyone. I cannot see who is the first one, but yeah, you all are correct. Very good. So basically the question is which of the following is not type 4? Because which of the following is not type 4, that is B cell mediated. The one which is the type 4, it is not B cell mediated, right? So question, the examiner is asking you question very indirectly, not directly. The question can be like as simple as that. Which of the following is not an example of type 4? It is the basically question. So he is asking the question in a other way. So what is the correct answer? So you know, just now I told you the mnemonic. What is the mnemonic here? Just a second. The mnemonic is John gave tulip popcorn to Hershey. So in this mnemonic, I guess C is contact dermatitis and tulip ka T is tuberculin and type 4 is delayed type. So all these are examples of type 4. But arthros reaction is sharp ka A, SHARP. It's type 3. It's type 3. So I will go with A and this is the reason. Yes. So yes, Kasoni is type 1. I told you. Yes. So correct answer here is arthros. You got my point? The next question is in front of you. Let me see who is the first. You all have to participate. At least you at max you will be wrong. Nah? It's okay to be wrong, but at least participate. So what is the correct answer here? Schultz-Dale phenomenon is what? Is it anaphylaxis in vivo, anaphylaxis in vitro, or atopy or cutaneous hypersensitivity? What is the correct answer from ABCD? What is the correct answer? What is the correct answer? Yes, very good. Very good. Meher, very good. Sushmita, very good. So correct answer here is anaphylaxis in vitro. Yes, so I told you what is Schultz-Dale phenomenon. So here we will take a guinea pig. We will sensitize the guinea pig with the antigen for the first time, but not the second time. We will kill the guinea pig, take the organs out, take in a ringer lactate bath solution and put the second dose of antigen outside the body. So we will see all the organs are contracting, right? Because they are already sensitized with the antigen. So that is Schultz-Dale phenomenon. The correct answer is B and you all are correct. Very good. Can you tell me the answer? It's very simple question. PK reaction, Putzner reaction is mediated by which type of antibody? Is it IgE, IgG, IgM or IgA? If you can identify the example in which it is coming, in which type of hypersensitivity it is an example. So I told you it's an example of type 1. What is the mnemonic of type 1? PCTS, proximal convoluted tubules. So P stands for Putzner-Kutzner. And in type 1 hypersensitivity, IgE have a role. So it's an indirect question. Yes, the correct answer is A, not B. Someone is saying B. No, B is not the correct answer. A is the correct answer and you all are right. Very good. So the correct answer is IgE. You can see these all are PYQs. I have not created any new question. These are the PYQs of various exams, right? So all the competitive exams PYQs related to this topic I am covering here. Can you tell me the answer, please? The next question in front of you. Be fast. What is the correct answer here? So stimulatory hypersensitivity is, it is a modification of type 1, type 2, type 3 or type 4. Basically stimulatory hypersensitivity is type 5. It's a PYQ. So it is a modification of type 1, 2, 3, 4. Yes. So yes, you all are right. It's a modification of type 2. Type 5 is a modification of type 2. The only difference is that here the antibodies which are formed, they are destructive in nature. And here the antibodies which are formed, they are not destructive, they are stimulatory in nature. I guess you all are correct. And not only this, many image-based questions also you will find in your PYQs based on the mechanisms of hypersensitivity. They will draw the mechanism and ask you to label the cell. So what is the first cell, second cell, third cell? So you can answer that only if you know the entire mechanism. If antigen is coming, what is the sequence of the cell which are get stimulated in various types of hypersensitivity? If you know the pathogenesis, you can do a proper labeling of the image-based question, which are very complicated questions. Can we go ahead? The next question is in front of you. Can you tell the answer, please? Anshul, the examples of type 5, I told you two examples. Myasthenia gravis and Graves' disease. I guess you have missed the lecture, but you must watch the recording later on. I have told you the mechanism also in detail. It's Graves and Myasthenia gravis. So MG is the mnemonic for type 5. I told you this. So coming on the next question in front of you. So erythroblastosis fetalis is an example of what? Is it type 1, 2, 3, 4? It was coming nowhere in the mnemonic, but you can use your common sense, right? I always say to the student कि exam के दिन common sense घर नहीं रख के जाना है. You have to use your common sense also. You don't have to think कि erythroblastosis fetalis तो कहीं आ ही नहीं रहा है. It is a type of blood transfusion reaction, na? And blood transfusion reaction was coming in type 2. What was the mnemonic of type 2? My blood group is Rh positive. B is type 2. Blood transfusion reaction, right? So correct answer is B. You can see it here. My blood group is Rh positive. Yes, the correct answer is B. You all are right. Very good. It's Rh incompatibility. So I told you both ABO and Rh are example of type 2, the incompatibilities. Coming on the next question. Which one of the following is wrong? Which one of the following is false? See the 4. Which one of the following is wrong? Theobald-Smith phenomenon is an example of type 1. Is it right or wrong? So what is the mnemonic of type 1? It's proximal convoluted tubules, PCTS. So T stands for Theobald-Smith. I guess this is correct. SLE is an example of type 3. What is the mnemonic of type 3? I guess you know the mnemonic SHARP, SHARP, and S is triple S. One of them is SLE, so I guess this is also correct. This is also correct. Coming on the next, transfusion reaction is an example of type 2. The mnemonic is my blood group is Rh positive. So B stands for blood transfusion and this is also correct. But see the example given here. Serum sickness is an example of type 2. No. This is the wrong thing. Serum sickness is one of the S here. It's triple S. So this is wrong. This is wrong. So correct answer here is B because false statement is asked. The question can be as complicated as this. But you can make it with fun. If you know the mnemonics, you can just apply it. So give me a thumbs up. You got it? You liked it? Next question is in front of you. Be fast. Type 3 reaction is what you will say. Type 3. Type 3. Is it antibody mediated or immune complex mediated or cell mediated or none? So tell me, what is the mediated? How it is mediated? Type 3. So don't get confused between A and B. In type 3, I told you the antigen is a soluble antigen. So the antigen antibody complexes, if you know the mechanism, after forming, they are going to the tissue. So it's the antigen antibody complexes which get deposited on the tissue and causing the destruction of the tissue, right? Tissue destruction and inflammation. So the correct answer is B. If I change the question, instead of 3, if I say 2, what is the correct answer from these 4 options only? Type 2 is mediated by. In type 2, the antigen is present on the surface of a target cell. So it is only antibody mediated, not antigen antibody complexes mediated. Here complexes are not going to get deposited on the tissue. Right, so it is antibody mediated. And if I change the question and make it 4, what is the answer now? Type 4. Type 4 reaction is, of course, it's cell mediated. Ek tarfa answer. Yes, you all are right. So we can change the question, we can change the answer. If you know the concept, we can do anything. We can solve any image-based question, we can solve any example-based question, we can solve any conceptual pathogenesis question, we can solve anything. So that's all about it. One more question. Yeah. So myasthenia gravis is an example of which type of hypersensitivity? Is it type 1, 2, 3, 4? Yes, what is the correct answer? I guess everyone is right. So it's an example of type 2. My blood group is Rh positive. So MICA M is myasthenia gravis. Everyone is correct till now. Everyone. But if I include option E as type 5, what you will say now? If there are 5 options and the 5th option is type 5, I will go with 5. So 5 is a better option to mark than type 2. If 5 is not given to you, then go with 2. My point to explain you is that The same I am asking for Graves' disease. Graves' disease also, if 5 is given, go with 5. If 5 is not given, 5 is the modification of 2, you know that. So go with that. So out of my blood group is Rh positive, my and group Mg are basically type 5. So we can include them in both. Yes, you all are correct. Very good, very good. You all are super intellectual students. Very good. So we are done with the first topic, hypersensitivity, but believe me, it was worth understanding the pathogenesis as well as examples. It's a topic which is common in patho, micro, you get many questions on this topic, especially in the micro section. Let me come on the next topic, few important topics from the immunity, right? Students find this topic very difficult, but I will make it a fun, believe me. Can we go ahead? Can we go ahead? Okay. Theobald Smith, I will explain you all the mechanism. Mitra, it's not the time I can explain you the mechanism of all the examples. I told you multiple examples, but the mechanisms will be discussed in detail later on, right? You have to learn the examples right now. Coming on the immunity topic, right? So in the immunity, there are two types of immunity. I want to explain you some concept here. So you know humoral and cell mediated. I guess every student know the difference between the humoral and the cell mediated immunity. Do you know? If the student, someone who is not knowing, let me explain you once, then I will explain you a concept here. So let me explain you what is humoral immunity and what is cell mediated immunity in short. So here is the antigen. Here also an antigen entering human body. Here also antigen entering human body. In humoral immunity, the antigen go to the B lymphocyte. The first cell, it will go to the B lymphocyte. And B lymphocyte convert into plasma cell. And plasma cell will form the 5 type of antibodies. IgG, IgA, IgM, IgD, IgE. Right? And these antibodies will interact with the antigen and destroy the antigen. Right? This is the mechanism of humoral, in which B lymphocyte and antibody formation take place. So the end result is antibody formation. Say yes. Everyone knows it. I know. Just for the revision I am saying, because I want to tell you a concept here. Let me explain what I mean to say. Coming on the cell mediated immunity. In the cell mediated immunity, the antigen which is coming, the first cell it will go is antigen presenting cell. It will not go to B cell. Antigen presenting cell will take it, degrade it. Just now I told you, granuloma formation. Take it, try to degrade it, and it will go to T lymphocyte, especially Th1, helper T cell, T lymphocyte. And T lymphocyte will secrete the cytokines that will result in granuloma formation, that will result in chronic inflammation, that will result in B lymphocyte stimulation also, the antibody formation later on, but as a second step, not the primary step. So that is cytokine release is the final end result. Here the end result is antibody formation, here the end result is cytokine, and these all will cause the destruction of the antigen. Ultimately, both the immunities are destroying the antigen. Here B lymphocyte is coming in role, here T lymphocyte is coming in role. This is humoral, this is cell mediated. Now listen my point. In both the immunity, one thing is common. What is the common thing? What is the common thing? The antigen is coming here and it is causing induction. Induction. This is known as induction of the immune system. This is known as induction. What do you mean by that? What do you mean by induction? Induction matlab, Hindi mein kahun to knock knock. Just suppose in human body, now I am a human body, inside me just suppose some antigen. Antigen is some foreign material. Some foreign is entering inside my blood, inside my human body. So it will do a knock knock to the immune system that I am coming. I have arrived. I have arrived. That is induction. So either the B cell or the APC will get induced and do the further response. So induction is the knock knock and stimulating, awakening the immune response that I have arrived. मैं आ गया हूँ, चलो काम करना शुरू करो. उसे कहते हैं induction. So induction यहाँ पे भी हुआ, induction यहाँ पे भी हुआ, right? And here the end result is antibody formation. So antibody will do the reaction. In the end, antigen will do the reaction. So first induction, then reaction with the end products. Here also first induction and then reaction with the end products. जो भी end products हैं उससे react होके खत्म हो जाएगा. So antigen will get destroyed after reacting with the end products of the immunity. Say yes. So in both the mechanism, there is an induction, there is a reaction, right? Induction is knocking the immune response. So it can be a B lymphocyte. If it's humoral immunity, it's a T lymphocyte. If it's a cell mediated immunity, the end results is different. Here the end result is antibody. Here the end result is cytokine. So here the antigen will react with the end products and get destroyed. Here also antigen react with the end products, get destroyed. So I mean to say there are two steps, induction and reaction. Both has to be followed. Induction and reaction. What are the two steps in both the immunity? Say yes. Induction and reaction. Now, the same thing is shown to you. What I mean to say, there is a difference in two terms, immunogen and antigen. Do you know the difference? If I ask you what is the difference between immunogen and antigen, it's a PYQ. What is the difference? You will say, ma'am, they are same. Most of the students, 90% will say, ma'am, they are synonym. No, they are not synonym. They are not synonym. Immunogen is a complete antigen that can induce as well as react. So it is coming, knocking and reacting with the end products. So it can induce plus react both. The one who can induce can react also. But sometimes antigen is very small. Imagine, I'm sorry, just a second. Okay, just a second, how it will go. Okay. So imagine an antigen which is very small. It is that small, neither it can induce the B cell, nor it can induce the T cell. No, it is very small in size, right? So it cannot induce the immune response because it is very small in size. But if ready-made products are present, formed by some other antigen, it can do the reaction. So induction नहीं करेगा, लेकिन ready-made माल मिल गया तो react कर लेगा. Ready-made. So it cannot induce but can react. So only react, no induction, that is known as antigen. So can I say all immunogens are antigen but all antigen are not immunogen? It is the PYQ from the AIMS, you know. Before this thing, we are having AIMS now. Now there is no AIMS, but yeah, it is a PYQ of AIMS, right? So all immunogen are antigen, but all antigens are not immunogen. Don't get confused in this. The vice versa is not true. You got my point? Say yes if you got it. So the main difference, I'm coming on all your doubts. Don't worry. So what is immunogen? Immunogen. And what is antigen? Can you tell me the difference, please? In short, so you will see, ma'am, immunogen can induce plus react. It is big enough to do the induction as well as reaction. But antigen is very small. It cannot induce but can react, right? React with the ready-made products. Say yes if you got the difference. So it's a PYQ. So all immunogens are antigen, but all antigens are not immunogen. Say yes if you got it. Say yes. If you got it, say yes, and let me come on the types of antigen. There are two types of antigen, the complete and incomplete. The complete antigen is immunogen only. That is, it can induce as well as react. It is big enough. But incomplete one is very small in size. It cannot induce but can react. Right? So the same, incomplete antigen is known as heptan. It is very small. The critical size is 100 kilodalton. The size should be more than 100 kilodalton if some antigen want to induce the immune response, either cell mediated or humoral. In both the immune response, minimum size should be this. If it is less than this, it cannot induce. It cannot induce, but it can react with the ready-made products. So complete antigen, incomplete antigen. Now the other name of incomplete antigen is heptan. What is heptan? Heptan पे बहुत PYQ है. It is the other name given to incomplete antigen. It cannot induce, but it can react. It can react. Is there a way to convert incomplete antigen to complete antigen? You will see, ma'am, only problem is size. Here size is big enough. Here size is very small. If you can increase the size, we can convert. We can think of converting incomplete to complete. Can we do so? Yes, we can do so. Can you see? This is the antigen. It's very small in size. See, it's less than 100 kilodalton. These are heptans because they cannot induce the immune response, but they can react with the ready-made one. These are the incomplete one. If I can provide a carrier to them, can you see? This is a carrier. It's a carrier. It's an inert material. It's an inert protein. Basically protein in nature, but it's inert, just to increase the size. So can you see? This one is binding on the surface of the carrier. So the incomplete antigen get converted to complete antigen. Say yes if you got it. Can we do so? Can we do so? Yes, we can do so. So we can convert the incomplete antigen to complete antigen by binding with a carrier. Can we go ahead? We will solve some questions based on it. Can you tell me the answer, please? Heptans are immunogenic when covalently bind to. Normally heptans, what are heptans? Heptans are incomplete antigens. Are they immunogenic? You will say, no ma'am, they are not immunogenic. So if you want to convert them in immunogenic, what you will do? You will provide a lipid carrier or polysaccharide carrier or protein carrier or any of the above. Just now I told you the carrier, but what is the nature of this carrier? The nature of this carrier is a protein. It should be a protein. Now tell me the answer. Of course, I told you the answer. I'm sorry, the answer is the protein carrier. Is it visible to you? Why you are not answering? Is the question visible? The answer is protein. Yes, Divya, very correct. The answer is protein carrier. Very good. Coming to the next question. Everyone is correct. The next question is in front of you. Now tell me the answer of the next question. So yes, everyone is correct. Very good. Which of the following statement is true regarding heptan? The first thing, students even don't know heptan hota kya hai. So how you will answer? First, understand heptan is incomplete antigen, a small one, which cannot induce but can react with the ready-made one. Now read the four options. it induces a brisk immune response. No, it not at all induces the immune response. Not brisk, not at all. ये तो गलत है. It needs a carrier. It needs a carrier to induce the immune response. Yes, I guess this is the correct one. It needs a carrier. Is it T independent antigen? No, it is not so. It is not associated with MHC? No. This is also not true. So I guess B is true and everyone is correct. Very good. Very good. I am happy that you all are participating. This is a hapton. It requires a carrier to get converted to immunogenic. Yes, very good. Protein carrier. Now someone was asking now among you, what is epitope, what is paratope? Let me come on the next topic, epitope versus paratope. So let me tell you, let me draw an antigen for you. This is the antigen and this is the antibody. It is binding with the antibody, right? So this is antigen binding with the antibody. Antibody have two fragments. This is the FC, that is constant fragment of the antibody, and this is FAB, that is antigen binding fragment. What is the full form? Antigen binding, because it is binding with the antigen. That's why this fragment is known as these two fragments. These are antigen binding fragments in the antibody. Say yes, this is the structure of antibody. I guess everyone knows it. Now antigen binds with the antibody. You will remember what you are saying. We all know this antigen bind with the antibody and form antigen antibody complexes. इसमें नया क्या है? सुनो नया क्या है? I will tell you. The complete antigen do not bind with the antibody. No, a portion of the antigen present on the surface of the antigen is binding with the antibody. So that portion is known as epitope. This is epitope. The exact portion which is forming the bond with the antibody is known as epitope. Yes. So can I say what is epitope? It is a part of antigen which actually forming the bond with the antibody, not the complete antigen. Only a portion is forming the bond. So can I say epitope is the smallest unit of antigenicity? ये बोलना सही है? Yes. Epitope is smallest unit of antigenicity, right? And what is paratope? Let me tell you. The corresponding portion on the antibody which is binding with the epitope is known as paratope. The paratope is the corresponding portion on the antibody which forms a bond with the epitope. So epitopes are present on antigen and paratopes are present on antibody. Epitope is the smallest unit of antigenicity that induces the immune response. So I guess everyone got it. What is epitope and paratope? So epitope is the immunogenically active regions present on the surface of the antigen, right? These are the smallest unit of antigenicity, and paratopes are the corresponding area on the antibody which bind with the epitope. Can you see? Can you see here? This is the antigen. On this antigen, I can see three different epitopes. See the shape. It's like a triangle, it's like a circle, it's like a square or rectangle, whatever. So different epitopes are there. Now it is binding to three different antibodies, antibody A, antibody B, antibody C. What I mean to say, specific epitope bind with specific antibody, specific paratope. What I mean to say, specific antigen binds with specific antibody, na? Actually, it's the specific epitope binds with specific paratope. It's like lock and key. Can you open any lock with any key? Of course not. We need a specific key for specific lock. That is known as lock and key hypothesis. So the lock and key hypothesis holds good here also, right? Specific key for a specific lock. You got my point? So for a specific epitope, you have a specific paratope. So only a specific antibody. So different antibody. ऐसा नहीं है कि सब पे same antibody A तीनों जगह आ गई. नहीं. Here it's antibody A, here it's antibody B, it's antibody C. Because the name of this epitope is A, the name of this epitope is B, and the name of this epitope is C. So they are structurally different, right? So that is lock and key hypothesis. Can we go ahead? So I guess you got the same thing is shown to you. Can you see? This is antigen. So this is epitope. And this is antibody. So this is paratope. See epitope versus paratope. Epitope present on antigen and paratope present on antibody. Can we go ahead? Can we go ahead? Anchal, I have already explained you. Can you please tell me type 4B cellular? So it is a cellular immunity. Now I have already explained it. You can watch the recording later on. Let me solve some questions based on epitope, paratope. Can you tell me the answer, please? Can you please tell me the answer? Can you tell me smallest unit of antigenicity? What is it? Is it epitope, paratope, complex hapton or simple hapton? What is the correct answer here? The smallest unit of antigenicity which is present on the surface of the antigen. I guess the answer is very simple. It's a baby question and everyone knows the answer. The correct answer is epitope. It is the smallest unit of antigenicity that is present on the surface of the antigen that actually comes in contact with the antibody. Say yes? Yes. The correct answer here is A. The correct answer here is A, and you all are correct. Coming on the next topic, a difficult, a complex topic, super antigen. Many students get afraid of this topic, I have seen. You should know the mechanism, the understanding what is super antigen along with the 10 examples at the tip of your tongue. 10 example याद होने चाहिए super antigen के. It's very common PYQ, right? Super antigen. To understand super antigen, you should have in-depth knowledge of the cell-mediated immunity. You will say, ma'am, we know what is cell-mediated immunity. Just now you told us this is cell-mediated immunity. You will say, ma'am, how? Okay, this is the antigen. This is the antigen. Okay, I will draw it for you. Better to draw. So this is the antigen entering in human body. Tell me the cell-mediated immunity. What happens? This is the antigen coming in human body. The first cell to which it comes in contact is antigen-presenting cell. What does it do? The antigen-presenting cell will take the antigen inside it. It will take the antigen, degrade the antigen, process the antigen into multiple epitopes, and the multiple epitopes will be expressed on the surface here. On the surface with the help of MHC. I will draw MHC also. Okay. So here is the MHC, major histocompatibility complex, present on the surface of the antigen presenting cell, on which the epitopes of this antigen get spreaded like this. They are presented. That's why they are known as antigen presenting cell. They are presenting the antigen on their surface, right? Degrading it into multiple pieces and presenting it. What is the next cell which will come in role here? The next cell which will come here is T lymphocyte. The T lymphocyte is coming in the role here on the surface of the T lymphocyte. So it will stimulate the T lymphocyte now. So just suppose in human body 100% T lymphocytes are present. How many of them will be stimulated because of this antigen? My question to you. I'm asking you this question. Because of this antigen, how many T lymphocytes will get stimulated? The answer depends on this epitope. On the surface of T lymphocyte, there is a receptor known as TCR. T cell receptor. What is the full form of TCR? So whatever epitope is there, the corresponding TCR wala T lymphocyte will get stimulated. Not all 100%. Whatever epitope is there, based on the structure of the epitope, the specific TCR jiske paas hai. Again, it's like lock and key. So for the specific epitope, that only TCR containing T cell will get stimulated. So it will be 0.2 or 0.3%. Hardly out of the 100. This is normal. This is normal. This is normal immunity, not super. This is normal antigen, not super antigen. Say yes. You got it. Now imagine an antigen which is known as super antigen. Now see what is the difference. This is a super antigen. It is not going. Super antigen do not go to APC. It bypass APC. पहला difference. It bypass APC. APC के पास जाएगा ही नहीं. ये बोलेगा मैं तो super antigen हूँ, मैं super hero हूँ, मैं सीधे जाऊँगा T lymphocyte के पास. मुझे APC की जरूरत नहीं है, मैं खुद stimulate कर लूँगा. That's why it's like a superhero. Right? It do not require APC processing. बोलेगा मुझे processing की जरूरत नहीं है, मैं तो सीधे चला जाऊँगा. ठीक है? So this super antigen is going directly to the T lymphocyte, and without the specificity of TCR, it is stimulating all T lymphocyte. So there is hyper exaggerated stimulation of T lymphocytes. T lymphocytes get stimulated exaggerated way. What does they do? Normally, what does they do? On stimulating T lymphocytes secrete cytokines, right? The cytokines will do the inflammation, they will do the granuloma formation, they will stimulate B lymphocytes also, so form a little bit antibody. So T मतलब cell mediated immunity में भी थोड़ी बहुत antibody तो बनेगी. This is normal. But since here abundant of T lymphocytes get stimulated now, there is hyper secretion of cytokines. That will lead to hyperinflammation. That will lead to hyper gamma globulinemia. That is the mechanism of super antigen. Give me a thumbs up if you got it. You got it? You got it? What is super antigen? So basically, can I say super antigens are potent activators of T lymphocytes? Say yes. These are the super antigens which activate the T lymphocyte directly without going to APC. They do not require APC. And without T cell specificity, without TCR, they will stimulate all T lymphocytes. Since they stimulate, can you see this is normal antigen? This is APC. On the surface, they are going to APC. On the surface of APC, this is MHC, major histocompatibility complex, and this is the antigen present on it. And it is stimulating the T lymphocyte having corresponding TCR. This is lock and key. So because of this mechanism, only 0.2% of the T lymphocytes will get stimulated. But can you see this is super antigen? See, this is normal antigen going. This is normal antigen going to APC, getting processed and expressing on the surface. So it is stimulating the T lymphocytes only 0.2%. So a limited cytokine will be secreted and a limited antibody will be there. But the super antigens are there, they bypass APC, they directly go to T lymphocyte. And without their TCR specificity, they are stimulating all T lymphocyte. So abundant of B lymphocyte will get stimulated. There is hyper gamma globulinemia. If you got it, give me a thumbs up. Can we go ahead? Learn the 10 examples at the tip of your tongue. 10 examples of super antigen. So 5 are bacterial, The 5 are bacterial, 4 are viral, 1 is fungal. Learn it. The 5 bacteria, 4 virus and 1 fungus. ये टिप पे रटा हुआ होना चाहिए. The examples of super antigen, it's very common PYQ. So Staphylococcus toxin. Which toxin of Staphylococcus? It is toxic shock syndrome toxin, exfoliative toxin which cause SSSS. You know what is SSSS? Scalded skin syndrome. And the enterotoxin which cause food poisoning. So toxic shock, exfoliative, entero, all 3 toxins of Staphylococcus are super antigen. The Streptococcus toxin, उसमें सिर्फ pyrogens, only pyrogenic toxins. The Mycoplasma, mitogen antigen 1, Yersinia enterocolitica and Yersinia pseudotuberculosis. So learn Staphylococcus, Streptococcus, Mycoplasma, Yersinia, double S M double Y, SMY. However you want to learn, but learn the 5 bacteria, please, at the tip of your tongue. Can we go ahead? Yes, the viral super antigen, Epstein-Barr virus, number 1, cytomegalovirus, rabies and HIV. Learn them. HIV encoded super antigens are there, some of them. And fungus mein only one fungus is there, Malassezia furfur. You may have heard of this fungus. I will teach you the details in mycology. Learn the 10 examples at the tip of your tongue. How you will learn? How you will learn? Tell me the name of the 5 bacteria. Tell me the name of 4 viruses. And tell me the name of 1 fungus. Who will tell me? Let's see who will tell me. What are the 5 bacteria? Staphylococcus toxins, the toxic shock syndrome, entero and exfoliative, all 3 toxins. Streptococcus toxin, only 1 pyrogenic toxin, right? And after that, Mycoplasma, Yersinia, the 2 types of Yersinia. Viruses में Epstein-Barr virus, cytomegalovirus, rabies virus and HIV encoded super antigens. Fungus में only 1 fungus, that is Malassezia furfur. Can we go ahead? Can we go ahead? Yes, so we will go ahead and we will solve some PYQs based on super antigen. Many questions are repeated from this topic. So super antigens are produced by all of the following the question contains except, don't miss except. So can you tell me the exception please? Yes, very good. Dilshad, very good. Pinky, very good. Can you tell me the answer here please now? So can you tell me the exception? The 4 options are Staph aureus, Enterococcus facialis, rabies virus and HIV virus. Which is not a super antigen? Not. I'm asking you, which of the following is not a super antigen? Let me see who is the first one. Yes, Avinash Reddy. Very correct. And everyone else is also correct. The correct answer here is B. It was not a bacterial example. I told you the bacterial viral, right? Yes. The correct answer is not C. Someone is saying C. Anil, no, it's not C. The correct answer is B. Rabies was there in there. The question is except. I guess you have missed the word except. So yes, the correct answer is B. You can see the 10 examples in front of you. You can make it out. Enterococcus facialis is not there in this list. So can we go ahead? We have completed a topic, hypersensitivity. We have completed many topics from immunity. The super antigens, the epitopes, the paratopes, the immunogen, the antigen, the types of the antigen, the haptans. We have completed many topics. We have covered the mechanism in detail of the 2 types of immunity, the cell-mediated and humoral. We have covered the structure of the immune system. Can we go ahead? So before going to the next topic, many more topics, I would like to give you advice to you. I have seen many students, they tell me every time, ma'am, बस इस बार कुछ भी rank लग जाए, कोई भी college मिल जाए, we will take it. We will not take the drop. And whatever rank is there, at least 10,000, 20,000, जो भी rank मिल गया, whatever branch is available, whatever college is available, I will take it. I will not. So this is not a way. This is not a way. Before your exam, I always say to my students, shoot out the moon. Even you miss, you will fall somewhere in stars. What does it mean? Aim for rank 1. Rank 1 is your moon. Aim for rank 1. Rank 1 मेरा है. किसका है rank 1? मेरा. This should be your determination. कि rank 1 तो मेरा ही है. Even if you miss ना, miss हो भी गया तो कोई बात नहीं. Rank 1 नहीं भी आया तो you will be in top 100. वो भी miss हो गया तो you will be in top 1000. But you should aim for the moon. Even if you miss, you will fall in the stars. If you already aim for the star, if you miss where, you will fall nowhere. You got my point? So aim for rank 1. Rank 1 मेरा है. ये होना चाहिए determination. And definitely with this positive attitude, with this determination, you will succeed and you will rock in your exams. Believe me. Believe me. So coming to the next topic, next important topic here that I want to discuss here is types of infectious diseases. The 3 types of infectious diseases, I guess everyone knows the answer, but there are many PYQs recently on these topics. The endemic disease, the epidemic disease and pandemic disease. You got my point? So can you see this is the earth. This is the globe we have formed, the earth. Now what is endemic? Endemic means the cases are present constantly there in that particular geographical region. You can see this is the geographical region, this is the geographical region, this is, so the cases are constantly present every time throughout the year. It is the constant present of cases, but in low burden, that is disease is endemic in that area. Say yes. So constant presence of certain disease in a certain population, but in the low burden, low intensity, low burden, right? That is endemic. Sudden outbreak in one area, sudden outbreak. Here only one, two cases were there. Suddenly there are 5 cases. So sudden increase in cases in one particular area is known as epidemic. Sudden outbreak. I will use the word outbreak. Now if you ask me statically, ma'am, how much should be the increase? Endemic से epidemic होने में increase कितना cases होगा? So I will say it should be more than 2 standard deviation. At least 2 standard deviation. More than at least 2 standard deviation का increase हुआ, you can say it is no more endemic, no it is epidemic. That is the statistical definition. Can we go ahead? Can we go ahead? And pandemic, if endemic crosses the continents, you know, on the globe we are having continents. If it crosses the countries and continents and become global, it's known as pandemic. Recently we are having a pandemic of the COVID, we know that. So that is the difference between the 3. Can we go ahead? Can we go ahead? We will see some PYQs based on this small concept. I will show you how many previous year questions are there based on the smallest concept. So let's solve the first question in front of you. Can you tell me the answer? The disease that spread rapidly involving many persons in a particular area at the same time is known as. Is it sporadic, endemic, epidemic or pandemic? What you will say? Let me see who is first. Avinash is saying C. What about others? What about, are you agree with him? Yes? Are you agree with him? So Jitu is asking a nice question. Now, even a 1 case found in polio in India, I will consider it as an epidemic. I will consider it as an epidemic. Yes, it's not endemic. I will consider it as an epidemic. Yes. Is it the answer B or C? You people are confusing. What is the correct answer? B or C? I am saying many people in one geographical area. The correct answer here will be C. It's epidemic. Many people in one area. Can you see the focus? It's the outbreak I am using. It's not B. Why you are getting? It's not endemic. If I say the word constant present in one area, it should be endemic. It is not B. It's B. C. Tanvi, you got it? Devyani, it's not B. The correct answer is C here. It's not endemic. It's epidemic. If there is any confusion, I am saying rapidly involving many person in one particular area. So it's epidemic. It's the outbreak I am talking about. So do you have any confusion? If it is there, please write down your doubt. The correct answer is C, not B. The next question is in front of you. There is a health center which reports 40 to 50 cases in a week in a community. There is a community, there is a village. Imagine there is a village. In that village, the health center report every week there are 40 to 50 cases constantly present every week, right? Now this week they reported 48. So this 48 is epidemic or sporadic or endemic or outbreak. What you will call? What you will call? I'm explaining once again. Wait a while. Sayatani, wait a while. I'm coming on that. First tell me the answer of this. What you will call? So normally 40 to 50 cases are there every week. This week also it's between 48. Now 48 is falling in this range. Now it's between 40 to 50 only. So it is the same range now. So constant presence of a disease in an area. I will go with endemic this time. This time the answer is C. So see in the last question why you got confused. I am saying if the disease is present constantly in one area, it is known as endemic. But if there is a sudden, I am using the word sudden increase, it is known as epidemic. So you can see I have used the word rapidly here. I have used the word rapidly, that is sudden increase of many cases in that particular area, not over all continents. If I use all continents, you use the pandemic, right? But it's, I guess the question is clear. So coming to the next question. Okay, good. So whatever mistakes you want to do it now, do it here. It's good to do the mistakes here. Even I appreciate, यहाँ पे कर लिया तो it will fit in your permanent memory. The same mistake you will not repeat in the exam. So whatever mistakes you want to commit here in the class. No harm in that. You will learn from your mistakes. It's good to learn from your mistake, but don't repeat it in the exam. So coming to the next concept. Okay. The next very important, I guess bacterial toxins everyone knows now. The 2 types of toxins, endotoxin, exotoxins. I'm leaving it. Many questions come on toxins, but don't leave that topic. Coming on the next topic, gene transfer, the genetics. Genetics mein we will take few important topics. The first is the gene transfer. So, can one bacteria transfer the genes to another bacteria? Yes, the 2 bacteria can do the gene transfer, one of the 4 mechanisms. So there are 4 mechanisms of gene transfers in bacteria we are talking. So it is transformation, transduction, lysogenic conversion and conjugation. These are the 4 types of gene transfer. I will explain you the little bit details of these along with the examples on which many PYQs and image based questions are coming. So let's start with transformation. I would like to draw a diagram for you, a beautiful diagram. Listen, this is a bacteria. This is a bacteria, this is the nucleus of a bacteria. This is bacteria number 1, right? And this is another bacteria, bacteria number 2. This is the DNA of this bacteria, the nucleus of this bacteria. The first bacteria is dead. I am saying the first bacteria is dead. Dead. Yes, you heard me right. It's dead. So once the bacteria is dead, it's bursted. It's lytic. It's bursted. So once this bacteria is bursted, the DNA will leak out. The DNA will leak out because the bacteria is dead. The free DNA which is leaked out of the dead bacteria will enter the second bacteria. In the second bacteria, you can see this is the blue color DNA of the second bacteria. The red one is the first bacteria, which is the dead now. Now the DNA is entering directly. DNA is entering directly without any agency. This DNA do not require any agency. It is entering directly inside this, the second bacteria and integrating here. So this method is known as transformation. In transformation, the DNA of one bacteria enters the other bacteria. Obviously, the first bacteria should be dead here. It is compulsory the first bacteria should be dead. So the DNA from the dead bacteria enter the second bacteria. It leaks out. Enter the second bacteria without any agency. उसको किसी एजेंसी की जरूरत नहीं है, किसी गाड़ी की, किसी मोटर व्हीकल की जरूरत नहीं है. वो मैं खुद ही चला जाऊंगा. So DNA is moving naked without agency. It's known as transformation. So what is transformation? It is the free DNA. The naked DNA is going. Can you see this is the second bacteria I have shown here. In this diagram, this is the second bacteria, right? You can see the blue color DNA in the second bacteria. Can you see this is red DNA? From where it is coming? This DNA is coming from the first bacteria. Where is the first bacteria? It is not shown here. It is dead. Imagine it's dead. The free DNA leaked out and it is entering the second bacteria. And it is entering here. And after entering, it is integrating. It is forming the episome, plasmid, whatever. So this method is known as transformation. एक चीज याद रखना, ट्रांसफॉर्मेशन मतलब डायरेक्ट, विदाउट एजेंसी. द फर्स्ट बैक्टीरिया इज डेड. ठीक है, तो मैंने बोला तुमने माना, ये बात अच्छी नहीं है. यू शुड आस्क मी, नो मैम गिव अ प्रूफ. ये होता है ना? यू आर सेइंग एंड वी आर बिलीविंग इट इज नॉट द थिंग. गिव मी अ प्रूफ. नो नीड. द ग्रिफिथ इज अ ग्रेट साइंटिस्ट जिसने ऑलरेडी इसको प्रूव किया हुआ है. आई विल प्रूव यू इन फ्रंट ऑफ यू. This transformation happens in bacteria. I will prove you in front of you. Griffith has performed an experiment. You know the famous Griffith experiment, the 4 mice experiment. पता है ये experiment? In short, I will tell you. The Griffith have done an experiment on 4 mice. 4 चूहे लिए उसने. 4 mice पे he has done an experiment. For that you have to understand there is a bacteria, right? There is a bacteria. The name of the bacteria is Pneumococcus. Have you heard about this bacteria? It is a bacteria belongs to Streptococcus species, Streptococcus pneumoniae, right? That is alpha hemolytic Streptococcus. It is pneumococcus. There are 2 types of pneumococcus. The one which have capsule on them. Can you see the capsulated version? The capsulated version. And the one which do not have capsule on them. The non-capsulated one. I can't see capsule here. Can you see the diagram? Appreciate the capsule here and appreciate there is no capsule here. So the capsule is making them smooth. The capsule is making them smooth. So these are known as S. Smooth version. And the non-capsulated one are the rough. They are rough. They don't have capsule. So these are known as R. So if I say S, you should imagine capsulated one. The diagram of capsulated. If I say R, the rough one, you should imagine this one. This should be fit in your imagination. Now learn one concept. The capsule is necessary for virulence. If this bacteria want to do the disease, want to kill someone, it should have a capsule. Without capsule, it cannot do anything. Right? So can I say the capsulated one are virulent? Yes. And the non-capsulated one are avirulent. So what we have learned? We have learned that in pneumococcus, there are 2 types of pneumococcus. What are the 2 types? The one which are capsulated. Because of capsule, they become smooth. And capsule is necessary for virulence. So they are virulent also. The other one are the non-capsulated. Because they don't have a capsule, come on, they are rough variant. They are S variant, they are R variant. And because they don't have capsule, they are avirulent. They are non-virulent. If you got it, let me do an experiment for you. A beautiful experiment. मुझे ये experiment बहुत अच्छा लगता है, right? I like this experiment. I will explain you also. You will also like it. Take 4 mice. Mice 1, mice 2, mice 3, mice 4. 1, 2, 3, 4. What I am injecting in them? See, listen. In the first, I am injecting the smooth variant, the live smooth variant. What will happen? You will tell me. right? Imagine. In the second, I'm injecting the live R variant, the rough variant. In the third, I'm injecting dead S, right? First tell me the conclusion here, then I will tell you the fourth one. You tell me. Who will tell me? Tanvi, Pal, Drishya, Kingstone, Nandu, someone among the audience, please. So can you tell me, S matlab kya? S matlab kya? It is having a capsule. It is virulent. You will say, ma'am, since it is live and this is virulent one, the mice will be dead. The end result is dead. This mice is dead, right? And in the blood, you can find this bacteria. Now here you take the live R are the rough one. They don't have capsule. They are not virulent. So this mice will be healthy. It doesn't have any disease and you can understand that. You will say, ma'am, yes, we can understand this mice is healthy. What will happen in the third? Here also we take the S like here. But this time the S are dead. We are taking the virulent one, the capsulated one. But dead bacteria can cause disease. No. Dead bacteria cannot cause disease. So this mice is also healthy. This mice is also healthy, right? Now in 2, the mice is healthy. In 3, the mice is healthy. Basically, I am mixing 2 and 3 and injecting in the fourth one. I am mixing 2 and 3 and injecting in the fourth one. So, live R plus dead S. I am injecting live R and dead S. Am I right? Yes. What I am expecting? मैंने expect किया कि अकेला live R alone, it's healthy. अकेला live S or dead S, it's healthy. लेकिन once I have injected the combination, the results were shocking. I was expecting the mice should be healthy, alone healthy, but the combination is dead. That was a shocking experiment. Everyone thought, why this mice is dead? Can you explain me why this mice is dead? Who is causing the death of the mice? Neither live R can cause the death, nor dead S can cause the death. Now imagine transformation. The first bacteria is a dead bacteria from which the DNA will leak. इस माइस के अंदर क्या हुआ होगा? Imagine the dead bacteria ने DNA leak किया होगा और वो DNA enter कर गया live bacteria के अंदर. So the DNA of the dead S is leaked out and has entered inside the live R. That DNA carries the genes for the capsule. So the live R start forming capsule and become virulent. The live R start forming capsule, become virulent, and if you see the blood of this bacteria, you can find live S. You have not injected live S. So the live R get converted to live S because of transformation. The experiment is proven. Say yes. You got it? What is transformation? So yes, transformation is the transfer of genes from one bacteria, the dead one, to the another bacteria which is live one through naked DNA without any agency. And Griffith has done the experiment. You know the experiment also, right? Coming on the next, the second type of transformation, the second type of gene transfer. It's transduction. Transduction. Again, I will draw a diagram for you. A beautiful diagram I will draw here. So this is bacteria number 1 and this is bacteria number 2, right? The red is the DNA of first bacteria. The blue is the DNA of second bacteria. I can say you can appreciate the colors. And this is the bacteriophage. What it is? Bacteriophage. You will say, ma'am, what is a bacteriophage? Bacteriophage, what is it? It is a virus. Bacteriophage is a virus which infect the bacteria. So this bacteriophage have a purple DNA. You can see the colors. This bacteriophage is going in the first bacteria, right? Integrating with the DNA of the first bacteria, taking a portion of the first bacteria, coming out, and after that injecting that portion in the second bacteria. So agency कौन है? The agency is bacteriophage, right? It's pick and drop. The bacteriophage is picking from here and dropping here. Pick and drop services, like, you know, it's pick and drop, like Zomato, like Swiggy, picking from one place, dropping to other place. That's it. So that is a job done by the bacteriophage. It's not the free DNA entering directly. No. The DNA requires an agency. And who is the agency? Who is doing the pick and drop? Who is doing pick and drop services? It's done by a bacteriophage. The bacteriophage is a virus, picking the DNA from one and giving it to the other. You got my point? Can we go ahead? Give me a thumbs up if you got it. So this is known as transduction, where a virus bacteriophage is acting as the agency of transfer. Here agency is required. So you can see the same. Can you see this is the bacteriophage entering first bacteria. यहाँ से थोड़ा सा चुरा के आया, चुरा के निकला, and it is the second bacteria. और वहाँ से चुराया हुआ, it is transmitting to the second. So it is taking from the first, giving it to the second. That is transduction. You got my point? The third you have to understand, lysogenic conversion. So in lysogenic conversion also we have bacteriophage. You will say, ma'am, then what is the difference between the second and the third, that is transduction and lysogenic conversion? Here it's not pick and drop. Here the bacteriophage will give its own DNA to the bacteria. You got my point? Here I will not draw two bacteria. Here basically I will draw only one bacteria. Bacteria 1. This is the first bacteria having red DNA. The red DNA, the first bacteria. And I will draw a bacteriophage directly. I am not drawing the second bacteria. Having the blue DNA. So the bacteriophage is giving its own DNA. The bacteriophage is giving its own genes to the bacteria which is integrating here. It is not pick and drop. This bacteriophage is not picking the gene from some other bacteria and dropping here. No. Its own genes it is transferring to the bacteria. So it's a type of gene transfer, no? It's a type of gene transfer. This type of transfer is between virus and the bacteria. So say yes, you got it. You got the difference between lysogenic conversion and bacteriophage. Shall I draw again? If you got it, say yes. How I will know that you got it? The transduction and lysogenic conversion. In transduction, we are having two bacteria. Bacteria 1, bacteria 2. But in lysogenic conversion, we have only one bacteria. You can see, I will draw the colors. Here the red DNA. Here also let's draw red. And here let's draw the blue one. Right. Now I will draw a bacteriophage. This is a bacteriophage having a green DNA. So in the first, this bacteriophage is transferring the first DNA to the second one. So basically it is doing the transfer of this red DNA, picking here and dropping here. So it is the transfer between the two bacteria through the agency of bacteriophage. And this is known as transduction. Right. But in lysogenic conversion, we have only one bacteria. We don't have two bacteria. So basically here the bacteriophage will give its own DNA or its own gene, I must say. Right, to this bacteria, and it will integrate here with the bacteria. That is known as lysogenic conversion. Say yes. The best example of the lysogenic conversion is Corynebacterium diphtheria. Corynebacterium diphtheria is a bacteria, diphtheria bacteria, right? It requires a gene for forming toxin, and that gene is known as tox gene. So that tox gene is given by the bacteriophage, the beta phage, if you remember the MCQ. Say yes if you got it. So this is the third one, lysogenic conversion, in which a phage DNA, that's own DNA will integrate with the bacteria. That's own DNA, the example is diphtheria. It's a very important PYQ. So you can see this is the phage DNA. It is entering inside the bacteria, and after entering it is integrating with that own DNA, not the other bacteria. So you got the difference between I told you na Mitra, the lysogenic conversion. Still you didn't got it, or you got it now. So that is the lysogenic conversion. So in transduction, the phage is acting only pick and drop services like Zomato, picking from one bacteria, dropping to other. But in lysogenic conversion, phage is contributing its own DNA to the bacteria. वो अपना सामान निकाल के bacteria को दे रहा है. You got it? That is the difference between them. Now coming on conjugation, the last one, the fourth one. Conjugation is known as sexduction. It's known as sexduction. That is mating or physical contact in the bacteria. If two bacteria want to do the gene transfer, they should come close physically. They should come close physically. They should form a tube between them. And through that tube, the genetic material will be transferred. The DNA or the genetic material will be transferred between the two bacteria. So that is known as sex in bacteria, sexduction in bacteria. That is known as mating in bacteria, the physical contact in the bacteria. That is known as conjugation. You got it? Can we go ahead? So there are three types of conjugation. I will give you the details of all three. The F plasmid type of conjugation, the Cole factor type of conjugation, and R factor. I will tell you everything. So let's start with the F. F1. F is known as fertility. Listen. Do you know this is a bacteria? Let me draw a bacteria for you. This is a bacteria. This is the nucleus of the bacteria having DNA. This is the DNA. Right? This is the nucleus having the DNA. DNA is the genetic material. Do you know bacteria, and it is forming the chromosome. Does the bacteria have extra chromosomal genetic material? Extra chromosomal. Apart from chromosome, is DNA present anywhere else in the bacteria? Yes, it can present in the form of the plasmid. So what is a plasmid? Plasmid is DNA only, but it is not a chromosome. It is not a chromosome. It is not a chromosome. It is known as extra chromosomal genetic material. That is the meaning of the plasmid, right? And plasmid also have genes. Like the DNA, like the chromosomes, plasmid also have genes, and that genes can express, right? That you may be knowing that. Now there is a plasmid. There is a plasmid which is known as F plasmid. F means fertility. The F stands for fertility. Listen, there are two bacteria in front of you. Can you see the two bacteria? This is bacteria 1 having F plasmid inside it. This is nucleus. This is F plasmid present. So this is known as F positive bacteria. F positive bacteria. And there is another bacteria, there is no F plasmid. The nucleus is there, but F plasmid is not that. So this is known as F negative. The one having F plasmid is known as male bacteria. And the one in which F is negative, there is no fertility factor, it's known as female. So you will ask me, ma'am, bacteria में भी male female होता है? Yes, bacteria में भी male female होता है. So in the bacteria which is having F plasmid, it's a male bacteria, the F positive one. And the bacteria which is not having the F plasmid, F negative one, is known as female. Now they will come close to each other, they will come physically close to each other, they will form a tube with the help of pilus, you know, fimbriae or pilus. So in the last lecture I told you what is fimbriae, pilus, right? They are forming a tube, and through this tube, the first bacteria, it is replicating the plasmid. It is forming two copies. The one copy is kept by himself and the second copy is given to the partner. So in the end, both become F positive. So you will say, ma'am, the female got converted to male. Yes, in the end, both are male. So before conjugation, one was male, one was female. But after conjugation, the femaleness is lost and both become male. So it happens only in bacteria, right? So you say you got the mechanism. So that is conjugation. Jitu, the use of conjugation, bacteria are transferring the genetic material from one to other. That is the use only. I will tell you the use and resistance. So you tell me what is happening in the bacteria. So at the start of the conjugation, one is male, one is female. One is F positive, one is F negative. At the end of the conjugation, both become male. Now this male can infect another female and transfer the genetic material likewise. So in this way, the genes can be transferred from one bacteria to another. So this mechanism is known as conjugation, and this is known as F type of conjugation. Say yes if you got it. Say yes. Come on, say yes. You got it? So that is known as sex factor, fertility factor. So males are the donors and they are F positive, and the females are the recipients. They are F negative. Right? So that is the thing. And the second one is the Cole factor. Likewise, inside the bacteria, there is another type of plasmid which is known as Cole plasmid. And that can also be transferred. And actually, Cole stands for colicins. Colicins are the antibiotic-like substances which are lethal to some other bacteria. So not very important, but you should know the name at least. The third one is really very important. The R factor. What do you mean by R factor? Let me draw an example for you. Then you will understand it better. This is bacteria 1 and this is bacteria 2. Both of them have the nucleus. So this is the DNA of the first, DNA of the second. And this is the plasmid. The first bacteria have a plasmid which is known as R factor. The second don't have it. Now I want to kill these bacteria. What I will do? You will say, ma'am, use antibiotic. Antibiotic kills bacteria. There are many antibiotics available in the market. You can use to kill them. So I'm putting antibiotic here also. I'm putting it here also. Here, on putting antibiotic, this bacteria will be dead. But on putting antibiotic, this bacteria is not dead. It is still alive because this bacteria have resistance for the antibiotic. This resistance is good for the bacteria. Bacteria is not killing, right? But it is bad for humans because I want to kill the bacteria. It is causing disease in my patient and I am unable to do so. So this R factor is good for the bacteria but bad for humans. Say yes, you got it. So I want to kill this bacteria, but I am unable to do so because it is having the resistance for that particular antibiotic, right? So the bacteria can have resistance for particular antibiotics. Now the bacteria, just suppose I am using tetracycline. So this bacteria have resistance for tetracycline. If I am using sulfonamide, this is having resistance for sulfonamide also. This is having resistance for say ceftriaxone or cephalosporins also. So my point is that one bacteria can have resistance for multiple antibiotics also. For each antibiotic, it is having a different gene of resistance, different segment, different gene of resistance. So one bacteria, it is not that the case that one bacteria will have resistance only for one antibiotic. No, one bacteria can have resistance for multiple antibiotics. Okay? Both these bacteria are pakke friends. They are best friends. Okay? So this bacteria, the second one, is asking the first one कि antibiotic आया तो तू तो बच लेगा, मैं तो निपट जाऊंगा, है ना? So मेरा भी कुछ कर, है ना? So these two are friends. So the second one is asking the first one, can you help me? If the antibiotic will come, you will alive, but I will be dead. Nah? I don't want to die. Come on, do something. You are my friend. So they will come physically closer to each other. And once they will come physically closer, they will form a tube. And the first bacteria will replicate. It will form two copies. One copy is kept by himself and the second copy is given to this. Right? So the resistance is transferred from one bacteria to another. Say yes. And now if you put the antibiotic, both will survive. This is the use of conjugation. Someone was asking, na? Say yes, you got my point. Say yes, you got it. So this is how resistance get transferred from one bacteria. Now this can transfer to the another one. This can transfer. So bacteria are helping each other by providing the resistance to multiple antibiotics, the genes for the resistance through the help of plasmid, and that plasmid is known as R plasmid. And it carries multiple. Can you see this diagram? Let me show you diagram. So can you see in front of you, you can see two bacteria. This is bacteria 1. This is bacteria 2, the two best friends. The first one have nucleus but have a R plasmid also. This is R positive, right? The second one have nucleus but doesn't have the R plasmid, and this is R negative, right? So they are mating. They are coming close to each other because this one is requesting to this one that please help me. So they are forming a tube between them, and you can see this is forming two copies. One is kept by himself and the second copy is given to the friend bacteria. So at the end both become R positive. So at the end this was already R positive, but the end the R negative also become R positive. Say yes, say yes. Now what are these things written? T for tetracycline, C for cephalosporin, S for sulfonamide, SU for sulfonylurea. They can be various antibiotics. It can be 1, 2, 3, 4, 5, multiple can be there. That I told you. But what is RFT? What is RFT? RFT is not an antibiotic. This is resistance transfer factor. What is RFT? RFT is always 1. What my point is that, so these genes for antibiotic resistance factor, these are known as R factor. They can be multiple. 1, 2, 3, 4, multiple can be there. But RFT is 1. RFT is a segment which is required for this transfer. Imagine one bacteria having all these genes, but that bacteria don't have RFT. So that bacteria can protect himself from the antibiotic but cannot transfer that to another bacteria. अगर ये फ्रेंड से रिक्वेस्ट करेगा कि मुझे भी दे दे रेजिस्टेंस, तू तो नहीं मरेगा, मैं मर जाऊंगा, अगर इसके पास आरटीएफ है तो ये ट्रांसफर कर पाएगा. अगर आरटीएफ नहीं है तो ये बोलेगा सॉरी मैं तो बच जाऊंगा लेकिन मेरे पास आरटीएफ नहीं है कि मैं ट्रांसफर करूं. तो आरटीएफ इज रिक्वायर्ड for the transfer. Say yes, that is resistance transfer factor. So in the R factor, two things are there. There is always one RTF and there are multiple R determinants that can be for different antibiotics. So they can be multiple. Say yes if you got it. You got my point? Can we go ahead? So that is the R factor. So what we have learned. So in genetics, we have learned the 4 ways of gene transfer between two bacteria. If the gene transfer takes place through free DNA, it's through free DNA without any agency from the dead bacteria to the live bacteria. It's known as transformation. The best example is Griffith experiment in pneumococcus. You know the details. The second, through the agency of bacteriophage. Bacteriophage is a virus. This virus is doing pick and drop service, picking the DNA from one and dropping it to other. That is known as transduction. This is transformation. This is transduction. Don't get confused. Don't get confused. The third is the lysogenic conversion. Lysogenic conversion, here also we have bacteriophage. But bacteriophage is giving its own DNA, not pick and drop. And conjugation is the sex in bacteria, sexduction in bacteria. That is physical mating, physical contact. In the bacteria, you know the 3 types of conjugation. The F factor, the R factor, the cold factor. You know the relevance of them. So this is the thing in front of you, the summary. The free DNA is coming. The free DNA, it's transformation. It is coming through the agency of a bacteriophage. It's transduction and it's through mating. It's conjugation. Lysogenic conversion is not shown here, but you know the details. Can we go ahead? Thank you. Thank you for the compliment. And please answer now. Please answer this PYQ. Can you solve it for me? Let me see who is the first one. Let me see. So bacteria genes are transferred by means of all of the following except. I guess the question is very simple. So they are asking the various means of gene transfer in bacteria. So transformation, transduction, mutation and conjugation. So which among the following is not, because the question is except, which among the following is not a way for gene transfer in bacteria? Absolutely right. You all are correct. The correct answer is mutation. Mutation is not a way of gene transfer between the bacteria, but the remaining 3 are there. The correct answer is C. Going to the next question. Bacteria which is used for Griffith experiment. Again, the question looks very simple. I guess everyone can answer it. Can you tell me Griffith experiment, the bacteria which is used? Is it Streptococcus pyogenes? Is it Streptococcus pneumoniae? Is it Staphylococcus aureus? Or is it MRSA, that is methicillin resistant Staph aureus? So what is the correct answer? Everyone is correct. Yes, the correct answer here is Streptococcus pneumoniae. And Griffith experiment is done for what? For proving what? Griffith is a scientist who has performed an experiment to prove what? The Griffith has performed the experiment to prove the mechanism of transformation in bacteria, which is a way of gene transfer between two bacteria through the agency of free DNA. Yes. So yes, this is the thing. The correct answer here is B, and you all are right. This is Griffith experiment. I guess this is suffice to show you the diagram, the 4 mice experiment. You know the details. Can we go ahead? Can we go ahead? The next question is in front of you. Movement of DNA from one bacteria to another bacteria through the formation of a tube. Through the formation of a tube or pallus. If a tube or pallus is formed between two bacteria, what does it known as? Is it transformation, transduction, conjugation, or lysogenic conversion? Who will tell me? So they are asking the mating in bacteria, the physical contact in the bacteria. Yes, everyone is correct. The correct answer here is C. Very good. The correct answer here is C. Yes. So let's move on. The next important topic on which repeatedly many questions are asked is the blotting technique. I have seen students find this topic very difficult, but it's, believe me, very, very easy. What do you mean by blotting technique? Imagine we are having a microorganism. What is a microorganism? It can be a bacteria, it can be a virus, it can be a fungus, it can be a parasite, it can be anything. Now this microorganism has some genetic material. It can be DNA, it can be RNA. I will say it's a genetic material. It can be DNA, it can be RNA, it's having some proteins also. So it is having DNA, RNA and proteins. Of course, the microorganisms have this, right? Now, this microorganism is present in my patient's body. I'm a doctor, the patient is in my clinic. I want to do the diagnosis, the exact diagnosis. What microorganism is it? Which bacteria, which virus, which parasite or which fungus? Exactly tell me the exact name. So how can I do so? You will say, ma'am, like humans have fingerprints. No two fingerprints are alike, na? Except the identical twins, right? In the same way, the DNA in the bacteria is like the fingerprints. The genes on the DNA are very specific. For each bacteria, for each virus, for each fungus, for each parasite, the genes are very specific. If you can do the diagnosis, which DNA, RNA or protein is it? We can identify the organisms exactly. We can identify the DNA, RNA and protein present in the microorganism with the help of blotting technique. That is the utility of blotting. हम कर क्यों रहे हैं blotting? So I'm having the sample with me. This is my test tube having the sample. The sample can be anything. It can be blood, saliva, CSF, stool, urine, having the microorganism. The microorganism can be anything, bacteria, virus, fungus, parasite. I want to do the diagnosis. So I'm having the sample with me. You got my point? So what I will do, I will perform these steps for blotting. So first I will take I'm telling you how to diagnose the DNA. In the same way we can do the diagnosis of RNA, we can do the diagnosis of protein. So first I'm telling you for the DNA. So first take the microorganism DNA. The microorganism is with you, na? Extract the DNA. Extract the DNA and convert the DNA into, with the help of scissor, cut at multiple points. Who is microscopy scissor? Who is the scissors? Who is the scissors in microbiology? There is an enzyme. The name of the enzyme is restriction endonuclease. They are like scissors. They give cut. They give cuts. Multiple places, they give cuts in the DNA. So we are cutting the DNA into multiple pieces with the help of an enzyme. What is happening? I'm sorry. So with the help of the enzyme, restriction endonuclease enzyme, the first step. After that, transfer, do a gel electrophoresis. Separate them with the help of their length of their DNA. DNA fragments की length के according you can arrange them. It is known as gel electrophoresis. After doing gel electrophoresis, transfer them on a nitrocellulose paper. On a nitrocellulose membrane, just transfer them. So you are cutting the DNA into multiple pieces, then doing the gel electrophoresis, then transferring them on a nitrocellulose gel. After that, you are taking a probe. What is a probe? Probe is the complementary DNA. You are having a DNA here, no? You are having a piece of DNA. So whatever microorganism you are suspecting. Just suppose in my patient, based on the clinical features, I am suspecting the patient is having HIV. So I will take the probe for HIV. All the probes are available in the market commercially. So the probe contains the corresponding complementary genes for that DNA, right? So you put a probe here. If the complementary DNA is present on this nitrocellulose paper, that will get highlighted. So that will do the hybridization with the probe and that will be highlighted. That can be detected. That can be detected with the help of X-ray. You got my point? You got my point? So that is the blotting technique. That is the mechanism. Now with this help, we can diagnose the DNA, the specific RNA and the specific protein. So basically there are 3 types of blotting technique. What are the 3 types of blotting technique? There was a scientist who is known as Southern. The name of the scientist was E.M. Southern. Southern एक scientist का नाम है. Southern north south east west वाला direction वाला Southern नहीं है ये. So there is a scientist known as Southern. उसने ये technique discover किया था. The scientists have discovered this technique for DNA. So to give the honor to Southern, we have given the Southern blot name for the detection of DNA. He have discovered this technique now. So Southern blot is for DNA. Now based on the Southern, to simplify it, we have make Northern and we have make Western. Northern and Western are names of no scientist. Scientist एक ही था Southern के basis पे Northern और Western भी आ गया. If we perform the same technique for RNA, it is known as Northern blot. And if we perform the same technique for protein, it is known as Western blot. So you will say, ma'am, how to learn? Southern is for DNA, Northern is for RNA, and Western is for protein. I am having a mnemonic for you. The mnemonic is very simple. You know, in South India, I am talking. The dosa is a very the famous food, right? So dosa, D for DNA. So Southern is for DNA. In North India, roti is very famous food, no? Roti is the staple food, right? So R for roti, R for RNA, right? So Northern is for RNA. And in the West, pizza is very famous food. So P for pizza, P for protein. So Western is for pizza. So South ka dosa, North ki roti, West ka pizza. Ab kabhi nahi bhologe. Now you will never forget. So what I have said, South ka dosa, D for dosa, D for DNA. Southern blot is for DNA. North ki roti is R, RNA is R. R for RNA, R for roti. So Northern blot is for RNA and West ka pizza. Western is for protein detection. P for pizza, P for protein. Give me a thumbs up. You got it. Can we go ahead? So the Southern blot, the Northern blot, the Western blot. Identifying DNA, identifying RNA, identifying protein. The technique is same. We use a probe. The probe will do the hybridization, and the hybridized section can be highlighted with the help of X-ray, right? We can detect it. So we can identify the suspected microorganism is present or not present, and we can exactly identify it. So that is known as blotting technique. Let's solve some questions based on that, right? This is a PYQ. Can you tell me the answer, please? I want to see who is the first one to answer. DNA is detected by which blot? Is it Southern blot, Western blot, Northern blot, or Eastern blot? D. DNA. D for dosa, D for DNA. Apply the mnemonic. Dosa and DNA. Right? So South ka dosa is famous, na? Of course, you all are right. Yes. South. Yes. So the correct answer here is A. For this particular question, the answer is A. We all know South ka dosa. I'm changing the question. You know what I will change? Instead of DNA, if I ask RNA in the same question, what will be your answer? Will you change the answer? Of course, you will change the answer. So R for RNA, R for roti, right? Roti kahan ki famous hai? Roti North India ki famous hai. So it's R. RNA is detected by the Northern blot, right? So the answer will become C, absolutely correct, right? And if I change the question again, instead of RNA, DNA, if I ask the protein ka P, pizza ka P. Pizza kahan ka famous hai? The pizza is famous of the West, so it will be Western blot. So based on that, you can change your question and you can get an image-based question also, right? Now, microbiology is a very potential, vital subject from which you can get many image-based questions like ophthalmology, like pathology, right? Like the instruments and clinical subjects. You will get many image-based questions from this subject also. So you should concentrate on all the images I am teaching you. You should have a concept behind that. रट्टाफिकेशन नहीं चलेगा, एक हद तक चलेगा, उसके बाद सब फ्लॉप शो है. जो चीज चलेगी वो कॉन्सेप्ट. Till your death, your concepts will be with you. So build concepts always, right? Wherever applicable, build your concepts, right? Wherever not applicable, अब मैं लिस्ट दे दूंगी कैप्सुलेटेड ऑर्गेनिज्म की, तो उसमें समझने का क्या है भाई? कैप्सुलेटेड है ये, 9 तो रटने हैं ना. For that, apply the mnemonic. Wherever factual knowledge are there, you have to learn the facts. Just apply the mnemonics. So understand concept and learn the facts with the help of mnemonic. Can we go ahead? So let me tell you some important topics now in systemic microbiology, in general microbiology, in last section also, in this section also. We have covered many important topics from general microbiology, from general bacteriology. Now let me tell you some important topics from general virology. Can we start? Are you people with me? Okay. So let's start the general virology. Can you see here the structure of a virus? In a structure of virus, two things are fixed. The first is the genetic material. It is the genetic material. It can be DNA. It can be RNA, never both. Mind my words, never both. The virus having DNA cannot have RNA. The virus having RNA cannot have DNA. It's not like human. The human cell have both. The DNA, we are having DNA also in each cell. We are having RNA also in each cell. But here we have either DNA or RNA, never both. You got my point? So that is the genetic material. I will say it is surrounded by a protein covering. This protein covering is known as capsid. Capsid is protein in nature. It's a protein covering. And it's a polymer. It's a polymer. It is made up of monomer. What is the monomer of capsid? It's known as capsomer. So multiple capsomers are present. These are the monomers everywhere present. These are known as capsomer. Capsomer will form the capsid. These two things are fixed in each and every virus. Whatever the virus is it rabies virus, HIV virus, ye virus, wo virus, polio virus, whatever virus, these two things are present in each and every virus. The genetic material, which can be DNA or RNA, never both, surrounded by a protein covering known as capsid. Now, the third thing, some viruses have envelope, some do not have. It's not compulsory. Some are enveloped virus, some are non-enveloped virus. You got my point? So envelope can be present, envelope can be absent. Envelope can be anything. It's not compulsory. So see, this virus is a non-enveloped virus. Can you see? Can you see? This is the genetic material and this is the capsid. This is known as naked. Naked means without envelope. Naked hai ye. Iske paas upar se covering nahi hai, no envelope. So two things are there. But this virus have three things. Number one, the genetic material. Number two, capsid. Number three, the envelope is also present. So this virus is known as envelope virus. Sometimes projectile, spike-like projections are present on the surface of the virus. These are known as papillomer. Again, it is not fixed. Some have, some do not have, right? So that is the structure of the virus, the basic structure, you got it. So can you tell me the answer of this question? Which of the following is always present in a virus? Always. Is it enzyme which is always present? Is it envelope which is always present? Is it DNA or RNA which is always present? Can you tell me what is the correct answer? Thanks for the concern, but I do not require anything. Thank you, Shalini, and thank you everyone for the concern. So can you tell me the correct answer here? What is always present? Let me see who is the first one. Thank you. Yes, Sushmita. Absolutely correct. The correct answer here is DNA or RNA. Yes, DNA or RNA is always present, but never both. See the word or. It's not and, it's or. So understand the meaning behind that. Yes. No, the correct answer is not A. Lokendra. Enzymes are never present in virus. Never. The virus uses host cell enzyme for doing all the functions. Enzymes are not present. So the correct answer here is C. Coming on the next question, it's in front of you. Can you tell me the answer? Capsid of a viral structure. What is capsid? What is capsid? Is it an extracellular infectious particle? Is it a protein coat around the nucleic acid? Is it an envelope around the virus or none of the above? What you will say? What is a capsid? Can you tell me what is a capsid, please? What is it? I'm waiting for your answer. Absolutely right, shredded medico. The correct answer here is B. Yes, it's a protein covering around the nucleic acid. Yes, it's not extracellular infectious, not envelope. The correct answer here is B, and you all are correct. Now, many students have trouble in learning the classification. You know, अगर classification learn कर लिया ना virus का, तो half job is done in virology. Believe me. अगर classification आ गया तो आधा काम तो ऐसे ही हो गया. Many questions are based simply on the classification. You will get a clue. There is a DNA virus or RNA virus. So option में से बचे हुए option हटा दो. So you are getting the 4 option, and in the question it's written a DNA virus. So see which of them are DNA or RNA, which of them are RNA, like that. So you should know the classification. There are 6 families in DNA and 15 families in RNA. I will give you 2 mnemonics to learn that at the tip of your tongue. So DNA virus is the 6th family, the RNA virus is the 15th family. You should know. Let's start DNA virus. What is the mnemonic? A beautiful mnemonic I am having. The mnemonic is HHAPPP. You can learn happy. HHAPPP. Double H is herpes and hepatidina. Double H. Only one A. A is adeno. Very simple. A is adeno. Right. And triple P is complicated. There are 3 P's. Virology में जो सबसे ज़्यादा trouble देगा ना तुम्हें वो P. There are many viruses with P. The 3 here and 2 RNA. Total 5 viruses हैं P से. And you will get confused in P. Always. Right. P बहुत trouble देगा. ठीक है. So triple P is there. One is pox. One is parvo. And one is papoa. Pox, parvo, papoa. Please learn that. So that is the 6 viruses in front of you. These are the name of the families having multiple viruses inside them. I'm not reading the name, but you should know the names of each virus inside each family. So these are the 6 families in front of you. First, give me a thumbs up. Now let me tell you 3 things here. Which is the smallest, which is the largest, and tell me which is the single-stranded. Okay, these are DNA viruses, na? These are DNA viruses, na? DNA single-stranded hota hai ki double-stranded? Normally, usually. So usually you will say, ma'am, DNA is double stranded. We all know that, of course. So all of them are double stranded, but there is one exception. Ek gaddar hai. There is one exception. Who is the exception? The exception is the parvo. Parvovirus is the DNA virus having single stranded DNA. It's a repeat PYQ. Learn the exception, learn the gaddar. Right? It's a single stranded DNA virus. It's DNA, but single stranded. Rest all are double stranded. Okay? That you have to learn. Parvo की एक और खासियत है, it's the smallest DNA. Among the DNA, this one is the smallest. Among all the 6, this is the smallest. Parvo. And which is the largest? The largest among these is the pox. So tell me 3 things, which is smallest, which is largest, and which is the single stranded DNA. Rest all are double stranded DNA. So all the answers are in front of you. So that's about DNA. Let me tell you RNA also, the same 3 things I will tell you in RNA. The smallest RNA, the largest RNA, and a double stranded RNA. Now, RNA viruses, I tell you, what is RNA? RNA is single stranded or double stranded? Normally, you will say, ma'am, RNA is single stranded. So, all of them are single stranded except one. You have to tell me that exception. So, the exception is the Rio. The Rio is the exception here. So, that is a double stranded RNA. RNA with double. Parvo was a single stranded DNA. Because all DNA are double stranded, but Parvo is going opposite. It's a single stranded DNA. And RNA, all the RNA are single stranded, but Rio is the exception, it is the double stranded. You got my point? Now let me tell you the mnemonic here, the 15 families I told you, na? So it's A, B, C2, C2D, 2 will be likh A, B, C, D, F2, A, B, C, D for, A, B, C, D for TPH. TPH कैसे याद करोगे? Tweet per hour. You can learn tweet per hour, or you can make PTH, parath hormone, whatever. A, B, C, D for TPH. Learn the mnemonic first. A, B, C, D for TPH. So there are 2C, 2F, 3R and 2P. Count, they are 15 in number. You can count if you wish. A for arena, B for bunia, C for, there are 2C. One is corona, one is calci. So calci and corona. I guess everyone know coronavirus is a RNA virus, right? So D is for delta. D is for delta. Where is D? Let me search. D is last one, delta. A, B, C, D. F, there are 2F. Philo and Flavi. One is Philo, one is Flavi. So where are the, this is Flavi and this is Philo. Right? O is orthomyxo. O is orthomyxo. There are triple R. Triple R, तीनों are ultra important. One is Rio, one is Rhabdo, and one is Retro. Retro is HIV. ठीक है? 3R. T is Toga virus. Where it is, just search it. It may be somewhere. Toga virus. And H is Happy virus. Again there are 2P. P बहुत trouble देगा. 2P हैं यहाँ पे. What are the 2P? Mark them with a different color. I will tell you the relevance. P for picorna. Okay, just a second. One P is for paramyxo and one for picorna. Right? Now one is smallest, one is largest. What is the smallest? Picorna, pico. You know picometer क्या होता है? 10 to the power minus 9. If you know pico, nano, pico, you know. Pico is 10 power minus 12. I'm sorry. Pico. So it is the smallest one. ऐसा याद करो कि pico बहुत छोटा है. Among RNA, this is the smallest. और largest कौन है? Another P. Paramyxo. Myxo का बड़ा भाई. Paramyxo. Para क्या है? Myxo का बड़ा भाई. Learn ऐसे कि बड़ा भाई है तो सबसे बड़ा है. So paramyxo is the largest one. Like I learn like this. Picorna and paramyxo. Picorna is pico. And paramyxo is myxo का बड़ा. Paramyxo. So this is the smallest. This is the largest. You got my point? Let me ask you 4 questions. Let me see who is the first and correct to answer. Tell me smallest DNA. Tell me largest DNA. Tell me smallest RNA. I will give you a clue. Wait. Smallest RNA and tell me largest RNA. Let me ask 6 questions. These are 4 na. Smallest DNA, largest DNA, smallest RNA. You have to answer in this sequence only. Smallest and largest, overall smallest. Among DNA as well as RNA. Overall smallest. And overall largest. The 6 questions, the 6th answer. I will give you a clue. It will be easy for you. All the answers are starting from P. This is the clue I can give you. You will get all options. The P. This is the clue I can give you only. The only clue. All of them are starting from P. Can you tell me the answers in this sequence only, please? The smallest DNA. Yes, it's Parvo. And the largest DNA, it's Pox. Parvo and Pox. The smallest RNA, it's Picorna. Picorna. And largest RNA, it's Paramyxo. It's Paramyxo. C. देख लो P का जादू. P. All of them are P. Don't get confused. Now my question to you is that parvo is smallest among DNA, picorna is smallest among RNA. दोनों में से ज़्यादा छोटा कौन है? Who is more smaller? That will be overall. तो दोनों में से छोटे में छोटा कौन है? ये भी smallest है, ये भी smallest है. But the smallest one is parvo. So DNA जो है वही overall है. So answer here will be parvo. Overall is parvo. और same question is largest. Largest में overall कौन है? Pox और paramyxo. So again the answer is pox. So both the things from the DNA only are the overall only. You got the point? So I mean to say these 6 points. I mean to say these 6 points. See and give me a thumbs up if you got it. You got the DNA smallest and largest. You got the RNA smallest and largest. Right? And see the overall. Nothing is mentioned means it's overall. So overall the answers are same as that of DNA. Overall the answers are same as that of DNA. Say yes. You got it? It's a very important MCQs. You will get many questions on this concept. You got my point? So let me help you in the revision. The final ultimate revision. Can you tell me the DNA viruses? Can you tell me the RNA viruses? The first thing, classify them. Let me tell you. Here there are 6 families, double H, A, triple P. Okay? Here there are 15 families, A, B, C, D. Right? FOR. For 2F and 3R. And tweet per R, TPH. I learned like this. Right? So there is 2P. Yes. So among them, let me ask you the question. Among DNA, which is the smallest, which is the largest? So answer are 2P. The 2P. So smallest is parvo and largest is pox. And among the RNA, which is smallest and largest? Among again the 2P. What are the 2P here? The smallest is picorna and the largest is paramyxo. And let me tell you the exceptions. Yeah, the most important, let me tell you the exceptions here. All DNA are double-stranded and all RNA are single-stranded, one exception. So here exception is parvo, which is single-stranded DNA. And here exception is R, one of the R, that is Rio, which is double-stranded RNA. You got my point? One more thing I will tell you here only. Among the RNA, among the 15 RNA, there are 4 RNA. There are 4 RNA which is having fragmented RNA. Among DNA, none of them is fragmented, it's in continuous. But here, 4 of them, among the 15, 4 of them have RNA in pieces, multiple pieces. That is known as segmented or fragmented nucleic acid. The mnemonic for that is BORA, B-O-R-A, BORA. I will tell you the full form also. B for bunia, O for orthomyxo, one of the R is Rio, फिर से Rio आ जाएगा, and A is arena, BORA. So learn them, right? Now I will tell you the questions. Can you tell me the answer, please? Who will tell me the answer? Let me see who is the first one. So Drishya, would you like to tell me? Credit Medico, others, Explore World. I cannot see the names. Yes. The HIV is retro, Shalini. It's not coming in the exception. Yeah. Retro don't have segmented DNA also, segmented RNA also. No. So can you tell me the virus with the smallest genome? I'm mentioning nothing, so I want to ask the overall. I have not mentioned DNA or RNA. So I want to ask the overall. Is it Rio, Parvo, Picorna or HIV? Of course, the answer will be one of the P. What is the correct answer? Someone is saying B, someone is saying C. You are getting confused. What is the correct answer? Yes, overall is same as that of DNA. That is Parvo. The correct answer is B. Right? You have to learn the smallest and largest. It's very important. Can you tell me the DNA virus with smallest genome? I'm changing the question. In the same question, instead of overall, I want to ask the smallest only but with DNA. Would you like to change the answer? I don't think so. The answer is still same, it's parvo. So overall का answer भी parvo है और DNA का answer भी parvo है. The DNA. Now I'm coming on the third question. The third question, the RNA virus. The RNA virus with the smallest, the answer will become parvo. Right? So you got my point. The segmented nucleic acid, I told you the mnemonic is BORA. B for bunia, O for orthomyxo, R for Rio and A for arena. You can see how many pieces the RNA is divided. So the RNA is divided into multiple pieces. You can see in how many pieces it is divided. It can be a question. Can you see the PYQ based on this? Segmented genome is found in all except. They are asking the exception. So which of the following virus do not have segmented genome? Do not have. Apply the mnemonic. Now answer will be in front of you. What is the mnemonic? The mnemonic is BORA. B-O-R-A. So I guess B, bunia is coming. I guess R, Rio is coming. What about the other two? Influenza. So influenza virus will come in orthomyxo. Orthomyxo virus is influenza only. But A is arena and here rhabdo is not coming in the mnemonic. So I guess the answer should be D, not A. No Tanvi, no. No Lokendra. No Shivang. Others are right. No Abu, no Pinky. Answer is not A. So you have to, I told you now, you have to learn the families inside the families. You have to learn the members of the families also. If you learn the members inside orthomyxo, you can see influenza virus is a part of orthomyxo. Can we go ahead? Can we go ahead? The last concept I would like to give you is about the envelope. Okay, how many DNA viruses you know? You will say, ma'am, 6 DNA viruses, double H, A, triple P. You just now you told us. Among them, how many have envelope? How many do not have envelope? Learn the viruses which do not have envelope. That is the naked one. Learn the naked one. So among the happy, the POP is naked. Learn like POP is naked. You will never forget. POP is naked. So the 2P and 1A. A तो एक ही है ना? A तो एक ही adeno. And which 2P? P का ही पंगा है. P का बहुत पंगा है. Right? So it's Papova and Parvo. It's Papova, Parvo, the smallest one, the exception having single-stranded DNA, and Papova. So that do not have DNA, the remaining 3 that do not have envelope, the remaining 3 have envelope. So remaining 3 mat yaad karo, H, HP, don't learn it. But yeah, these 3 do not have envelope. Among the RNA, how many RNA viruses you know? You will say, ma'am, 15. How many? Tell me, 15. Do you know the name? A, B, C, D for TPH. You know the full form, right? Among them, only 3 are naked. The 12 have envelope. Don't learn the 12 names that have envelope. Learn the naked one. The naked is PCR. So learn POP and PCR are naked. The POP among DNA and the PCR. What is the full form of PCR? P. P is picorna. C is calci and R is Rio. Say yes. So POP and can you see the DNA viruses? Can you see these all are 6 DNA viruses? All 6 are shown to you. These are the 3 which have envelope on it. I can see envelope, I can see envelope, I can see envelope. But these are the 3, they don't have envelope. These are the naked one and the naked is POP. P-A-P, POP. POP is naked. You got my point? Among the DNA. Among the RNA, all 15 are not shown to you, but maximum are shown to you. These are the RNA viruses, almost they are 15. So you can see these 12, almost these 12, they all have envelope. See the envelope on them. All have envelope. But these 3 do not have envelope. Only 3 do not have envelope. 12 have, 3 don't have. So that is PCR. PCR. Picorna calci Rio. So PCR is naked. So यहाँ से POP naked है और यहाँ से PCR naked है. Never forget. So finally this is the summary. This is the summary in front of you. See the DNA, see the RNA. See 6, see 15. Here there are 6. Here there are 15. So among the 6 divide 3 plus 3. 3 plus 3. The 3 enveloped, the 3 non-enveloped. So total 6 you know happy. Double H, A, triple P. Happy, happy. ठीक है? Among the happy, the POP is naked. You know the full form of POP. And the remaining HHP are enveloped. Say yes. And among the 15 ABCD for TPH, the PCR is non-enveloped. The remaining 12 are enveloped. If you know this concept, things will become super duper easy for you. Let's solve a PYQ based on this. Can you tell me the answer? Which of the following is not a DNA? Not a DNA virus. Simple question, simple answer. Can you tell me which of the following is not a DNA virus? Can you apply the mnemonic? Double H, A, triple P. What is triple P? Pox, Papova, Parvo. All of them are DNA. But rhabdovirus is not coming in the DNA. I guess everyone knows the answer. And the correct answer here is D. I guess everyone knows the answer. Yes, absolutely right, Nandu, Nishant. Everyone is right. The correct answer is rhabdo. It was coming in RNA. The correct answer is D. You can see the classification. The next question is in front of you. Non-enveloped. Tell me a non-enveloped RNA virus which is single-stranded. Tell me 3 things. So 3 things should be applicable to that virus. It should be a non-enveloped. It should be single-stranded. It should be RNA. Tell me the non-enveloped RNA. RNA में PCR is non-enveloped. So answer इन 3 में से एक होगा. अब इन 3 में से non-enveloped, which of them are coming in the options? I guess only Picorna is coming in the options. The pox virus is a DNA virus. Retro and Bunia is not coming in this mnemonic. It's Rio, it's not Retro. So I guess the answer is clear cut. It's Picorna and all RNA viruses are single-stranded. Yes, you all are right. If you know the classification, now half job is done. I'm saying again and again, right? So that's all about it. It's a never ending. I have to teach you the symmetry. I have to teach you inclusion bodies. I have to teach you the replication, eclipse cycle, von Magnus phenomenon, and the virus cultivation. These are the important topics in virology you cannot afford missing. You have one MCQ definitely from these topics. But the time is limited. I have to stop now. You know, I wish if I can teach you more, but currently I will stop here. Wait a while. And I will try to take more sessions like this. Do you want more sessions like this only on the microbiology? We can revise the entire microbiology in this manner, making the entire microbiology a fun for you. So if you want more sections, kindly write down in the comment section. I will plan more sections very frequently, more and more sessions, and try to cover all important topics in microbiology like this only, right? So if you want it, kindly write down in the comments. So thank you so much for being with me. Before ending, I would like to tell you something. What? Many students ask me a thing, ma'am, most of my friends already started studying from months and I have wasted a lot of time. And now I'm having anxiety and I feel like, is it too late to start? Can I start now? What if I start the preparation now? Can I succeed? Can I get a top rank? Can I get my dream branch? I get number of messages from multiple students daily like this. Is it too late to start? So all those students who are thinking this way, my advice for all of them. First of all, stop comparing yourself. Please do a favor on yourself. Stop comparing yourself with others. The first thing, stop comparing yourself with others. If you want to compare yourself with someone, now compare with yourself. What do you mean by that? Compare your today's performance with your yesterday's performance, and every day your performance should be better. In this way, you will bring the best version of yourself. Compete with yourself, not with others. Try to bring the best version of yourself. Now, everybody have a different race. Some start slow, gradually pick up the pace, and some start fast and eventually slow down. The people who are ahead of you will not always remain ahead of you. The people behind you will not always remain behind you. Come on. The time changes, the circumstances changes. The circumstances changes. Do you know the hare and turtle story? Have you remembered? You may have heard that story in your childhood. Always remember that story. Slow and consistent win the race. You shouldn't have be slow actually, but you should have consistent, right? So definitely, and I would like to stop here. So be consistent and mind your own studies. Stop comparing yourself. Thank you so much. Wishing you all the best for your exams, and bye-bye. Definitely, I will try more and more sessions. Very soon I will plan and let you know. Bye-bye.